Welcome to the Douglas County Board of County Commissioners meeting for August 5th, 2020. We want to welcome any of you who are at the Douglas County Courthouse or are joining us online. Just a bit of information regarding how we run our meetings on Zoom during this time of social distancing. If visual aids are used during the meeting, the presenter will share the screen with the call. Participants will not be able to view them without a computer, smartphone, or tablet. All participants will be entered into the meeting with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be unmuted when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their line when not speaking, introducing themselves each time when they speak. If you have a public comment or an agenda item or under regular public comment, please use the raise your hand function on Zoom. Staff will call on you and unmute you. We ask that speakers give their names and address for the minutes. The county reserves the right to shut off the microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. The chat function has been disabled and a recording of this meeting will be available on our website after each meeting. All commissioners are here. I think Commissioner DeRusso has not been feeling well, so we'll have her camera off today. And we'll jump into our agenda. We'll have the agenda ready to go. There it is. We have a consent agenda that has 3 items. Our regular agenda items, which will be the review of the CARES Act Round 1 reimbursements and direct aid plan, appointments, general public comment, and then commissioner or administrator miscellaneous. So with that, is there any item on the consent agenda that a member of the commission would like to have pulled for conversation or discussion?
I do not.
None. Is there any member of the public who would like to remove an item from the consent agenda for comment? And how we do this is Sarah is at the courthouse. County Administrator Sarah Plinsky is at the courthouse. Is anyone there, Sarah, who would like to have an item pulled from the consent agenda?
No.
And Jill Jolliker is our online monitor. Jill, anyone online? I must have not heard Jill. Jill, anyone online? No. Okay. Yeah, I don't think Jill's mic is working because it says she's muted. Okay, you'll get there. So no one online. So I would take a motion to approve items 1, 2, and 3.
So moved.
Thank you. Moved.
Second.
Moved and seconded. All those in favor say aye. Aye.
Aye.
Passes 3-0. We move on to our regular agenda, which is a review of the Douglas County CARES Act Round 1 reimbursements and direct aid plan. And for this, we turn it over to Sarah.
Thank you, commissioners. What we're going to walk you through here is a tremendous amount of work that this organization has put together with a number of community partners over the last 30 days to put together a proposal. Just as a little bit of a recap, Douglas County was allocated almost $25 million in the first round of CARES Act funding. Though the eligible expenses for those were included in the commissioner's packet, largely focusing on health and medical, but also leaving room for distance learning and business grants to small businesses. We used our recovery coordination team to do the work to help us partner with us to prepare this proposal. The recovery support functions inside that recovery team of education, economic impact, health and medical, and housing and human services each took this work very seriously and developed proposals to help build out our plan. In addition to that, municipalities are eligible for reimbursements. All public entities are eligible for reimbursements for funds spent from March through July, and they were also eligible for putting together direct aid plans for moving forward. Who you have on this call here, or on this, I want to introduce our team that's been working most closely to put this together. I'm going to then walk you through the highlights of the summary information, and then each of us are going to walk you through a section. So with that, I want to introduce Brooks Tower and the administration office, who has been our spreadsheet guru, pulling together literally, she texted me, we had 245 tabs on this spreadsheet that you will get today. She has been largely responsible for making sure everything is accounted for and added for, and that we are in preparation to be able to submit a program to the state. Robert Benecki and Jillian Rodriguez have been helping us from emergency management and really took on Rodrig. I always apologize to Jillian. I always say her last name incorrectly, but Jillian Rodrig. They have helped us with taking the educational group RSFs and helping us get those prioritized for the order. Daviana Humble helped us with economic impact and recovery, along with Jasmine Moore, who was helpful in that process as well. And Jill that has really led and shepherded the work of the Housing and Human Services group, both during the process of developing the recommendations and then here internally as we put them together. I took the work of health and medical and helped get it prepared here for the plan. And Brooke and I both kind of worked on reimbursements and direct aid plans for municipalities. So with that, I'm going to share my screen with the overview information. All right. So as you can see here, Douglas County started off with an allocation of $24,997,333. This spreadsheet will walk down. I'm going to try to scroll down here. I'm smart enough to do that. We received a total amount of reimbursement requests from public entities of $2.6 million. Included in this plan is $1.98 or $2 million in recommended reimbursements. Commissioners, I'm going to walk you through this whole thing, and then we're going to take each chunk of this step by step. Under direct aid requests from municipalities, Douglas County originally had a direct aid request of $11.3 million. We've reduced that down to 1.2. City of Lawrence had a request for $2.2 million. Right now, their request is just under that at 2.2. We had a request from the city of Eudora. This direct aid plan request was submitted at $854,000. It's currently at $792,000. Baldwin City submitted $13,456, and it is included as is. Grant Township submitted a request for $94,000, and we do not have that direct aid plan in our request. We'll walk you through it so that you can see what each area is. I want to say at this point, and we'll talk about it more once we get into the direct aid plan request. These were some of the last pieces that were submitted to us this week. This is what I consider, I'm going to go all the way through it and I'll tell you the story. So RSF1 for economic recovery, we had over $11 million in requests, and we currently are sitting at 1.2. Health and medical, we had 12.2 million in requests. We're sitting at 11.3. This is the largest area that we are funding in our CARES Act, and that is really driven by the criteria established by the state for coronavirus relief funds. Housing and Human Services had 2.8 million in requests, and we have included funding for almost 2.5. Education asked for 7.5 million, and we currently have them in for 3.8. So as you can see here at the bottom, we had a total total request for 33.7, and we currently have funding for 8.8 in the plan. when you add the reimbursements of just under $2 million and the direct aid plan requests from of the cities, we're currently sitting at $24,979,336, which is $17,000 or $18,000 under our total allocation. So we had over 50 million in requests. That's where I pegged we would be. There are a number of extremely important and valid requests that have been placed before us that are not included for funding at this time. I really wish we had 50 million to give out, and we could certainly do even more good than we're going to be able to do in the community. But I don't want to completely focus on the negatives here at the outset. Inside this request, and as I said, this is just a draft, but inside our current recommended model, you have almost 1.5 million for rent and utility assistance for this community for the rest of the year. And that's the low end number. There's more than that in there. You have 2.7 million for surveillance testing in our community. Over 50 organizations are slated to receive funding, and in this model as we stand right now. So I know that there's a lot of folks that are disappointed that we were not able to get more funding out to the community. But I do feel like we have made a really good start at a draft here to show the commissioners to move from here. So I also want to say at this point, because this is a rough draft, many of the requests that have come to us, we know we need to do some work to add things back in, but that's going to take some reductions. And I think this is really where I need the commission's direction as to how to do that. When each of the recovery support functions were rating their requests, they didn't do that work of, could a partial request give the group, you know, a majority of what it needs in order to support more. So that's really where our work comes in now as a commission, and to get ready for the 12th is some of that, what I would call load leveling, to sort of determine if we need to move things around a little bit to make sure that we can get all that taken care of. At this point, I want to turn it over to Brooke Sauer. I'm going to stop sharing my screen, and she is going to share her screen, and she's going to walk us through the reimbursements. And while she is pulling that up, I want to state the first thing of sort of importance related to reimbursements. So there are three types of entities inside the public service reimbursement model. There are municipalities, there are school districts, public school districts, and there are health organizations. Where possible, I've really tried to seek consistency in this plan. So if a type of expense was covered in one area, I wanted to be consistent in its coverage throughout the plan. So to that first end, payroll expenses. We had some entities, some what I'm going to call municipalities, so that includes the county in that piece, some cities and the county who submitted requests for payroll reimbursements. We made a decision at this point to take that out of what you see. So, and we can certainly walk through that and have conversations about it. So the cities that are represented here in the county have no reimbursement for payroll related expenses in the reimbursement column and or the direct aid. As we move to school districts, there is some funding for reimbursement mostly related to food service. So there's food service payroll expenses are included as if they were submitted from school districts. And then there's a number of payroll related expenses for the health agencies included for reimbursements, and those are in and have not been reduced. So if there are specific questions, I'm going to turn it over to Brooke to kind of walk you through them, but I wanted to sort of, I think the kind of major theme of reimbursements is payroll.
Hey, Sarah,
Yeah.
quick question, just some housekeeping. Would you mind having someone resend the state's criteria for what's eligible for round one funding? I've been looking for that and I can't come up with it right now. It'd be helpful to see that as we're talking.
Okay, yes. Let's see. I will try to see if I can do that while Brooke is talking.
Sarah, I may have something in one of our PowerPoints that we used before that we could try.
There was a memo and I thought I had maybe attached it to the commission packet. So I believe it's in the commission packet, but I'll see if I can pull it up.
Hey, Sarah, I have a memos folder in my municipality toolkit folder. You might check in there.
Okay.
And thank you, Sarah, and thank you, commissioners. I'm excited to get to walk you through some of the information on this spreadsheet. First, I wanted to start out and let you know a little bit about the spreadsheet and how we're using it. So this tab right here is the summary tab. As Sarah kind of went through some of those programs, direct aid requests and reimbursement requests, I want to let you guys know that each of these fields is a hyperlink to the tab. So when you're on that summary page and you want to take a closer look at something, you can just click the name in that table and it will take you directly to that tab where it has what those agencies requested of us. So that's for the reimbursements. You'll be able to get there by clicking the name. For the direct aid requests, I just put the hyperlink right here in the header. So if you click that header, it'll just take you right to that tab that you need to go to. I tried to make it a little bit easier to navigate through some of these tabs, specifically on the spreadsheet where there are 245 tabs. It will be really helpful as you're looking over those programs and thinking about you know, how to move through that document. On this particular workbook, I have two columns here. One is for the amount. This is what they asked us for. And this is the amount that comes with the recommendation. Can you guys see that okay? Would it be helpful does that look okay? Okay, so if something was not recommended with the reimbursement or even with a direct aid request, we would simply back that value out there and then it would automatically update on the summary page. So as you get this document and, you know, if you want to move around numbers, you can do that in this column here. So that's just a brief overview of this workbook. If you have any questions about it as you get it and you're in there and you're you know, trying to get from one tab to another, please just let me know if you have any questions about that. Go ahead.
Move into that. Yeah, I want to explain. So there's going to be two major documents here, and they really have two different purposes. And I know this is a ton of information. And we really have to cut this information in two ways. Brooke has to cut it by program type and expenditure category, which is what you're going to see on some tabs. And in some cases, what we know the commission wants to know is what is the whole program or what is this agency receiving? So we've kind of have to slice it in two different ways. I also want to mention, well, because Brooke is doing what I should have introduced, that she's going to kind of do some housekeeping to walk commissioners through this request. The other piece of this that we will show you later, but it was very important to this process and I don't want to diminish, were the equity impact statements. We had over 200 equity impact statements prepared. Every program received one and every project was evaluated by its impact it would have on equity work. And we'll walk you through that information, and that will also be made available to commissioners and the public as we continue to review these decisions. All All right, I'll turn it back to you, Brooke.
Yes, thank you, Sarah. So like Sarah said, this document is this workbook rather, is the workbook that compiles all of those requests. So as you can see here, administration submitted a direct aid request, Public Works submitted a direct aid request. And so on this index sheet here, I have your hyperlinks in 2 locations. So one of the hyperlinks will be to the individual tabs where the requests are located. And then there's another hyperlink that will take you to the summary. The summary also has a hyperlink column that will take you to individual requests within that workbook. Now, this is the workbook that has 245 tabs. So I have put little shortcuts to get you back to the front of the workbook at the top of these sheets. So if you want to go back to the index, you can just click that and it'll bring you back here. There's a long list here. So please, it's just really long. If you have any questions as you're navigating through this document, please let us know. And I think someone is probably going to send these to you after the meeting today. They have been updated since the initial draft was sent. So yeah. Do you guys have any question about the functionality of the workbooks or anything that I can answer before we get into the reimbursement portion? No? Okay. All right. So I will walk you guys through the requested reimbursements from the public agencies. We solicited public agencies for their reimbursement requests through this process, and each agency submitted their reimbursement requests to us, and I've compiled those here. So Douglas County, we had about $88,000 in reimbursement. Most of this was for improvements to telework. So, you know, our continuity of operations, cleaning supplies, PPE, there were some technology costs. I know I personally grabbed a cell phone from Jamie downstairs when I was working from home. So those are the type of expenses that you'll see inside of our reimbursement request. The City of Lawrence reimbursement request, again, you know, similar type expenses, PPE, improvements to their telework infrastructure. They had far fewer telework infrastructure requests simply because they received a Bureau of Justice Assistance grant. And with that grant, they used a lot of that funding for that purpose. So you'll see a lot of the public health expenses. Now, as Sarah mentioned, there was some cuts made to the reimbursement requests for the City of Lawrence, and primarily those were comprised of one contractual for technical assistance, and then mainly payroll related requests for temporary staffing. So somebody got completely reassigned to help mitigate COVID, overtime for essential workers, and then unified command staff. That was also included with that request. So the total cuts for the payroll and then that one technical assistance piece is the $611,665.37. The City of Eudora, they had some cuts as well, mainly related to payroll, like Sarah said. For those, for that municipality specifically, they had some hazard and backfill pay. They had a PNR position and then a charge for the police department. And those cuts totaled $22,599. The City of Baldwin, their entire submittal was paid time off for COVID leave, and that was cut. That payroll item was cut for the City of Baldwin. Grant Township, again, they had COVID leave for their township staff. That was cut in its entirety, and that totaled $6,500. Perry Lecompton, they did not have any cuts. They have about $90,500 for distance learning, reopening measures in the amount of $14,347, and then they had some public health expenses in the amount of $10,400 related to some equipment and some PPE. For USD 348, mainly distance learning, and then public health expenses again. Total recommended funding is their full request of $15,992. USD 491 for Eudora, they also included, so I think Sarah mentioned this, they included some hazard pay specifically as it related to the grab and go program. I don't know how it relates to USD 491, but I know that specifically for 497, they ran that program during the shutdown. It was a non-revenue generating program, and they provided meals for free 7 days a week to 18, not just to include school-age children, but also to include those who were 18 and older. So we left the hazard pay for the grab and go in for 491. They had a few like a safe graduation charge for chair rentals, so they could do that outdoors. And then PPE and cleaning supplies came in at around $18,000. And then, oh, I'm sorry, they also included transportation for that grab and go program. That was about $6,200. And a small technology charge of $780. Their total funded is $33,536. And then finally here, USD 497, as Sarah mentioned, they had about $16,627 in for their grab and go program. This is funding at 21.1%. So it's not even the full cost of the labor to run that program. And then included with this request also are materials for food. So Highland Dairy products, and then bags to give the meals to people. Distance learning was about $68,000. PPE was about $23,000, and then they included a little bit of funding for some telework infrastructure for USD 497. They came in at $183.47. LMH health reimbursements, mainly testing, contact tracing, PPE. They did include the labor costs and also the FEMA portion, which they included 15% of the cost for Category B expenses that will be covered by FEMA. And then those who were reassigned due to response for COVID. They also included some COVID leave paid to their staff, and their request totals $757,737. Lawrence Douglas County Public Health, we did not recommend any cuts for their reimbursement request, primarily made up of payroll, meals for volunteer staff, folks who are doing that contact tracing, and then payroll, if I didn't mention that. is primarily what their requests for reimbursement are comprised of. I know that's a lot of information in a very small amount of time. And as you guys get this workbook from us, you'll be able to really go through these with a fine-tooth comb and check them out. Does anybody have any questions about the reimbursements thus far? No? Okay. All right. Sarah, I'm going to go ahead and turn it over to you to discuss the proposals that were submitted with RSF2.
Thank you.
Yep.
All right, and before I do that, I want to pull up, Commissioner Thurman, the eligible expenses, just so we can reiterate that to the group. And for those of you following along at home, you can find this in our commission packet. We included this in our memo and our agenda agenda item report as to what are eligible expenses. So medical expenses for testing, emergency medicine, telemedicine, any sort of public health related expenses for PPE, sanitation, disinfection, technical assistance on mitigation, quarantine measures, payroll expenses, largely for public staff, for public entities engaged primarily in COVID response. Actions to facilitate health measures, so food delivery for residents and vulnerable populations, facilitation of distance learning. This is where the school districts and educational groups get distance learning in. It's important to note here, the state has told us that it's distance learning for educational institutions, not distance learning for public entities. So that's a distinction that we've had to go through and make. Telework for public employees, not private employees. Maintaining sanitation and caring for homeless populations to mitigate the effects of COVID-19. And then the last area is economic support. So provision of grants to small businesses to reimburse the costs of business interruption and any sort of workforce development programs, consumer grant programs to prevent eviction. Those are other eligible expenses. So, and I'm going to walk you through, before I jump immediately into the rest to RSF2, I want to show you the direct aid plans from each of the municipalities so you can see that. And then, so I'm going to share that screen. So this is back to our all programs compiled spreadsheet. And this shows the municipal, I'm gonna probably have to switch back and forth between a lot of these. So actually, maybe I'm gonna stop sharing this one first and just see if commissioners have specific questions on some of the direct aid plans, and then just share the summary, and then we can go to that if you need to. I'm going to get us back to the beginning here. All right. So.
Sarah, real quick, it's Robert. Who can let Jillian in as a panelist?
Any of the co-hosts can. So Jill, can you take care of that?
Thank you.
So so as I said before, we receive direct aid requests from municipalities. We also receive them from educational and a whole bunch of other people. But cities and the county didn't fit well into the RSF structure. So those were submitted directly to the county and evaluated. The direct aid proposals for everyone else was sent through the RSF process. So the reason why I'm going to pull these out is they did not go through an RSF process. They came straight to the county and we evaluated them. The first of the direct aid requests is Douglas County's, and we requested a total of 11.3 million. We currently stand at about 1.2. In that 11 million was a number of, multiple $1-million requests to help us, with some capital repairs and capital needs at the jail to help ensure that we can maintain our jail population as safe and free from COVID as possible. As I discussed with the commission last week, my hope is that we can, once we get the CARES Act decisions done, we can come back as a body and talk through if there are things that we can do with funds that we have set aside to help there. That would include the renovation of the courtroom into video first appearance, as well as creation of some other units to try to create more cells to keep people isolated and quarantined. That is not included in our request. Largely what's included in our 1.2 million is a number of court-related items and to improve technology and technology access for the court. Also PPE and sanitation for that as well. And I can certainly show the commissioners that tab. This is the tab that has the Douglas County Direct Aid Plan, and you can see the descriptions in the program titles and the departments that have submitted them. It's largely PPE and protective health measures, as well as some technology. The City of Lawrence Direct Aid Plan consists of a number of different, oh, look at her, she did this, she puts these little summary tab pages for me so I can go right back to it, if I can get it to go. The City of Lawrence put in a number of direct aid plan requests. They asked for 2.2 and they're just at like 2.15 at this point. We have only reduced them slightly based off of some ineligible expenses put forward. So I'm going to go through those requests. And that's probably a little too big. The City of Lawrence submitted a number of requests, the largest of which was around $700,000 for air cleaning equipment and air cleaning installation. This would be advanced air cleaning techniques for all of their city facilities. That was over $700,000. I'll tell you that that was requested in a number of plans, and we've consistently left it in. However, there are pretty big chunks of equipment, but those were included in most of the proposals. City of Lawrence has also asked for a significant amount of funds under economic impact to support a utility assistance program, and that is included in here as well. $500,000 is included for subsidy payments to utility account holders due to economic hardship associated with COVID-19. There is also a pretty substantial request for, and at this point, I think I'm going to kind of turn it back to the other document that I think kind of shows the individual requests a little better, for a campground for the persons currently experiencing homelessness. Is this the right one, Brooke? I think I.
Do the all programs compiled.
That's what I thought. I apologize, commissioners. Here we go. So this is the electronic air cleaning program from the City of Lawrence, utility bill assistance. And then I'll move to the Lawrence campsite. So this would be a Lawrence campsite, a temporary campsite for people experiencing homelessness. The estimated costs are here below to provide a campground to help make sure that our homeless population can remain as safe as possible during this event. All of these funds would need to be spent in this year in order to be eligible for the program. There's the library has submitted a digital equity expense program to help provide resources to the community to help address digital equity. They have a program for thermal scanner screening units for the city of Lawrence, with contactless thermal temperature screening units to be evaluated. That request is $66,000. They have a request to do a community-based childcare program. They have asked for funds to help support their remote video broadcasting of their meetings, which is approximately $45,000. They included funding for their wastewater testing program. They also put in a request for personal protective equipment for employees. I would say this is general employees. You're going to see another request under health and medical for LDCFM employees. They requested funds for a Lawrence downtown sanitizer, for hand sanitizers, dispensers in downtown Lawrence, a child care proposal, a communications proposal to help develop an emergency notification system for sensitive COVID updates to city staff. That request is $9,000. They asked for some funds to help leverage and support CARES Act grant funding across the community. So it's a pretty small request, but to help assist with that program throughout the community. They asked for some portable trailers for utilities to help create some social distancing for their MSO employees. They asked for a racial impact capacity, this is a really interesting proposal to spend about $115,000 to continue the work of the equity impact advisors inside our coordination team to continue to do training for that COVID response team and then move that out through the various RSFs. There's a program here for Lawrence classrooms, which would be monitored classrooms to help with Wi-Fi for the Boys and Girls Club. That request is pretty small as well. And then they are asking for reimbursement of their Just Foods cost that also is included in the county's request. And if you guys, commissioners, tell me if I'm going too slow, if you'd like to just stay at the high level and I can try to move through it faster. I want to say here, the direct aid plans have I have not had an opportunity to go in them in a lot of detail and reduce them in certain levels. I was hoping to get some direction for the commissioners as to areas that they would like to go into before we go into that a little further. I'm going to jump to the Eudora programs. So the first one, and there, I have not had an opportunity to really visit with Barack about this program. He had asked for a small business development program, which would be in total about $369,000. I think we need to think about the size of this request in comparison to what we have for other businesses throughout the community and economic impact. This is a pretty large request in comparison to what we have in other areas. So I do think that this is an area where we may look to try to see if we're being consistent between Lawrence and Eudora and other communities. So this one I think needs a little more work. Eudora Utility Assistance, they are putting $163,000 towards utility assistance in their community. They have asked for a community Wi-Fi program to help enhance distance learning and Wi-Fi in Eudora for approximately $81,000.
Sarah, I'm sorry to interrupt you, but can you talk a little bit about the decision? I mean, you've said now on 2 of these that you haven't had much time to really dive in to look at the programs. Can you talk a little bit about, I mean, there's 200, did you say there was 245 tabs just in the reimbursement?
No, in total, the total plan.
In the total plan. So has your team gone through all 245 and vet? I mean, I know in our county budget process, you spend time with each community partner and, you know, to sort of ask them about, have you done all of that? Has that been done?
We have done it, I would say, Commissioners, I'm starting with the area that we have done the least in. So direct aid plans from municipalities, I've had the least amount of time to go into great detail. Everything you see from here on out with the RSFs has been very completely vetted, and I feel really confident about what's in those tabs. So what you're seeing, we're starting with the direct aid plans from the municipalities, and these are the ones I feel less confident about what the commissioners, as the vetting of the plan. But I do think, like, I mean, some of it were hampered by just the time constraints of where we were. We received these from cities Monday morning. And then we had to present them to the recovery team on Tuesday. So this is a rough draft, but if commissioners have specific areas where they feel like this is something that they're not supportive of, it's certainly going to help us as we get down the road here with other RSFs. In all reality, though, we did not receive that many direct aid plans from municipalities. It's our own, City of Lawrence's, Eudora's, Baldwin's is very small, and then I'll get through the Grant Township. But those are the only municipality direct aid plans we received.
Okay.
We did cut from Eudora's request. I'll get to that one in a minute. They asked for a number of expenses for cleaning and PPE for the remainder of the year. They broke it out by the whole city and the fire department. They asked for funding for telework for the remainder of the year. So an approximate, quite a bit of fund to continue with telework, $37,000. They asked for payroll support to help cover any leave related to COVID. We have eliminated that based off of the recommendation that we followed in the reimbursements that we not cover payroll. And they did ask for a small project with the Eudora Public Library for the digital equity expenses, and those are included. The City of Baldwin just has 2 small requests. So they asked for a small amount of funds to help for sanitation for the rest of the year, a total of $2,400. And they asked for a very small amount for their digital equity impact associated with their library for a total of $11,000. Now I want to talk a little bit about Grant Township, because it is sort of a unique situation. They asked for $93,000 in capital improvements for the community center associated with Grant Township. It's important to note here that this township hall is currently rented by a private school. And so largely these professional cleaning, new HVAC system, new sinks, new faucets, new toilets, dispensers, trash cans, and this work would be to support the township, to support the private school. And Grant Township's defense, they called us and said, should we submit it under the township or should we submit it under education? And we said, well, you own the building, so you submit it under Grant Township. However, when you get down to RSF4, you will see that we did not rank high priorities for capital improvements and modifications related to educational institutions. So with that in mind, that these types of improvements were not paid for under RSF4 for education, I did not include it in our total as it stands today. There are other expenses in here related to webcams and computers that I think would be largely used by the township staff. We did not receive that request from other townships, so at this point in time, it is not included. I'm not saying we couldn't go back in and look at this a little bit more precisely, use a scalpel, not a knife, to try to figure out if there are pieces we can add back in, but at this point in time, I was not able to, it is not included for funding. So before, and I want to explain something before we jump, I'm going to go back to the stop share this tab, and I'm going to go back to the all programs compiled. We're going to start with RSF2 tonight, instead of RSF1, and so our plan is to go through 2, 3, 4, and then do 1. That is largely based off of how our funding recommendations, that the guidance from the state of Kansas is that we are to fund health and medical and public health related expenses. So I want to put that in front of you first. And then we'll go, and I'm going to cover that for the team. And I've asked to be a part of this conversation tonight, and I'm going to move them over because they have been so patiently awaiting this conversation, and I really do appreciate them being on the line for this. I'm going to move over Russ Johnson, who is the CEO of LMH Health, and Sonia Jordan. She has a very fancy title. I think it's like Director of Informatics or something, but I don't always remember it, but I know it's really cool, and she's a tremendous asset to our team in this work, because the real theme here, that one of the main topics I want to talk about inside RS2 is community testing and community surveillance testing. So we received a number of requests from a number of RSFs to talk about how can we just test our people every 2 weeks to make sure they don't have COVID. And LMH has put in a large request that is included for funding of $2.7 million for community-based surveillance testing. So I think what I'd like to do is maybe open that conversation up for a little bit of conversation before we jump into the whole RSF2 process. And I know I'm kind of putting Russ and Sonia on the spot here, but if you could kind of just outline briefly our philosophy for community-based surveillance testing as we move into the last half of this year.
Sonia, do you want to jump in there first? How do you want to do that?
I'll have you go first because I'm kind of trying to balance a baby and get to a quiet room.
Okay. Thank you, Sarah, and thank you, commissioners, for including us in your deliberations. There's really two components to testing. There's symptomatic and, as Sarah said, surveillance testing. And as we look at resources that can move into surveillance, it really becomes, if you will, an extension of a deeper, broader symptomatic methodology. So let me try to explain that a little bit and put a disclaimer right off the top that I'm not an infectious disease doc, and I am largely basing these remarks on the dialogue with our 3 infectious disease docs and the directions that that they are advising us on. So I think the notion that we had was that it will maybe be better for the community if there is one central point of expertise around surveillance and broad symptomatic testing, so that for a few things. Number one, consistency of testing procedures, so that we don't have multiple different kinds of tests with different specificity, reliability types of, and validity types of capability, and frankly that they're bona fide and recognized. that the administration of those tests is consistent across all points of care. And so we know that the data that we're getting back is as reliable and usable as it can be. And that we're just making sure that we have appropriate expertise. Secondly, I would say, and probably closely related to that, is the whole notion of clinical oversight. So testing and protocol development is not just, hey, wouldn't it be cool if we could test our employees over here? And so then you get that data, and what do you do with it? And how does primary care fit into that? How does it fit into public health? How do we partner with Sonia and the team at Public Health on disease investigation, tracing, et cetera? And all of that has a clinical oversight. And thirdly and lastly, the notion of compliance and regulatory standards, that let's make sure that if we want to do broad testing, and if we have the resources to do broad testing, that we're following CDC, KDHE, Joint Commission, and other regulatory and compliance directions. So that's kind of a backdrop for why we put forward this. And the other reason that we felt like this made sense is we were having parallel conversations with KU and others that were going to be on the order of 5,000 to 10,000 tests anyway. And so as we began to think about that, we felt like we should at least put a proposal before the commission to say, if we want to do broader surveillance testing, then we should go ahead and provide that option to the city or the county in what I believe is the very least expensive model you could have. And if you look at the cost of this model, it is very, very low outside of the cost of the test itself. The administrative and resource and staff expectations, I think, are relatively low. So when I talked to Dr. Scrimshire about this, she said she made a point about the notion of broadening symptomatic testing and into surveillance, because either one of those needs to be kind of a strategic clinical algorithm, not just, hey, we got 50,000 tests, first come, first serve. Instead, that we would work with the county and public health and our other partners to identify where, who is our priority parties that we want to invest surveillance testing into. Where are the stakes high? Maybe that's law enforcement. Maybe it's public safety. Maybe it's first responders. Maybe it's teachers. That will remain to be seen based on the determination of school districts and return to school and all that. So we recognize that, it's not about just getting 125,000 tests and putting an ad in the paper and saying, hey, show up if you want to. But we are going to build the capability where we can do upwards of 1,000 people a day, and potentially we can even expand that if we determine, or if clinicians determine, we really have this targeted group, we want to get them through in this specified period of time, and if so, we can do that. So Sarah, I'll end my remarks there because I'm not sure what all will be helpful. And Sonia, maybe you have some other things that would be enlightening from public health point of view.
Sure, thanks, Russ. That was really well said. So I'll just add a little bit of context about why we don't recommend, why public health in general doesn't recommend universal testing for a community. So the first reason is that the test is really only good for the day that you take that test. So if you get a negative result on a Tuesday from a Tuesday, then your result is good for Tuesday. You could pick up COVID Wednesday you could have picked it up Monday and it has not had time to develop a viral load or is still incubating in your body. That's not going to be detectable on a test. So that's one of the primary reasons we recommend it. Secondly, if you're just doing kind of random clinical testing, like Russ kind of alluded to this, without any kind of clinical oversight, then you're not doing the necessary work to determine when is actually the best time to test somebody. I'm sorry, hold on. There you go. So you're without that clinical oversight, then you don't know, we should test them between 5 to 10 days post-exposure so that we have the best chance of determining and getting a positive test. 3, testing is not infallible. It's subject to human error, similar to how anything else is subject to human error. So you could not get the swab far back enough to get a proper sample. You could be in a situation where the swab was not stored properly, or maybe the lab test messed up. And it's not perfect because humans aren't perfect. And that's why we rely on other things like epidemiological exposure or clinical symptoms to determine who is the best person to actually test. And the last reason is that with the testing supplies the way they are, we think it is best to try to prioritize either particularly vulnerable populations that are high risk, or populations that have some type of exposure. Now, if somebody is symptomatic, we can work with them through the health department. There are a lot of different routes that someone can go to get a test if they're symptomatic, but in general, we recommend against just kind of the broad swath testing everyone, because without an infinite amount of tests and without the capacity to do that, every week or so, it really doesn't provide us with much information, and it's really not beneficial. The last thing that I think is important to note is that if somebody doesn't have a clinical oversight like Russ was talking about, they could be subject to a false sense of security without understanding what a negative test really means. They could put some of our more vulnerable populations at risk. If they got a negative test on Tuesday, the virus was still incubating, they developed symptoms on Thursday, but they saw their grandma on Wednesday. That's a false sense of security from that negative test, that they just put a vulnerable member of our population at risk. So that's kind of the context that I wanted to add. I'd be happy to answer any questions, and I'm sorry for all the background noise.
Absolutely.
Sonia,
No problem, Sonia. Thank you.
Sonia, thanks for being here, and Russ, thanks for being here as well. This is Commissioner Kelly, and we have a number of requests from these RSFs that are for testing, and then we've also heard like KU wants to do. Are you telling us, in your professional opinion, or those you represent, Russ? That was a joke. That you think that all testing should happen at one place and should be targeted, rather than lots of different businesses and organizations doing testing on their own? Is that what I'm hearing from you?
Yes. So I think, as Sonia pointed out, specimen management, handling, labeling, it seems pretty simple, and it is largely pretty simple. But when stakes are potentially higher, it's not something to do on the fly or without people, I think, that are effectively trained to do it. And I think, Patrick, our proposal, if you will, enables the county to consider that as we go along, there could be targeted populations of people within the limitations that Sonia really excellently outlined, but there could be targeted populations of people where it says, okay, it makes sense for us to get a baseline here, or let's respond to this, or maybe there's a group of people that we do over and over again throughout a period that doesn't give us certainty, but it gives us maybe directionally accurate information. And so for me, Patrick, going back to your initial question, it doesn't make sense probably to have 30 or 40 or 50 employers or different groups all trying to connect with a laboratory, buy a test, take custody, fill it out, distribute it, gather that data for public health, liaison to public health about what it is they ended up finding. And so I think in those ways, a little bit of rigor and a little bit of consistency could serve us well.
Thank you.
I really appreciate both Russ and Sonia taking some time out of their evening to be on this call with us tonight. I do think we as a recovery support team and a unified command for education need to elevate this conversation in the community. I think right now in a time of so much uncertainty, the one thing that seems certain is a negative test result. And I think so many people just want to grab onto that and sort of say, I know I don't have it. But really, from what we're hearing from medical professionals, it's more important that we're consistent and that we're strategic and we're clinical in terms of our approach of who we decide to test and when. And I do acknowledge that I think we need to do a better job of elevating that information to our community at large so that they understand it, given the very reasonable fears that everyone has faced in this pandemic.
And can I just ask a quick question? And I haven't had a chance to really study this very much, but so I want to make sure I understand that the hospital's proposal would attempt to be the tester for it would be KU, it would be our citizens, it would be our special vulnerable populations, it would be our school, our K through 12 school systems, it would be everybody. And so is that true? And then are these tests still, are the folks who get these tests still responsible for paying for them? There's a cost for people to have these tests, or is that cost within this request? Or, I mean, is there an impediment to folks getting a test if they're not able to pay?
Yeah, the costs for the tests and the administration are in the proposal. So it did not contemplate, Nancy, or Commissioner Thellman, a cost to patients. There's no profitability built into this. I think we put in the standard overhead of 5%. I would say the other thing to this is that we would, while we would be administering it and have site and capability established, we'd work close with public health on who, how, what to do with it, what the results are. You know, what is our capacity not only for testing but for follow-up that's meaningful. And I know public health is looking at an option where mobile testing would be an option. I think that's another important piece of this solution. And we're also creating through this proposal, looking a little further downstream in the ability, let's say that a vaccine does occur and we need to administer a vaccine to 100,000 people, then we would be coordinating with public health on how do we distribute that vaccine, but creating a physical capability to administer, again, you know, 800 to 1,200 a day, and helping work with public health about, okay, where should we do that? To Sonia's point, how do we start with vulnerable populations first and make sure we're helping them get in? What if they can't come to a location? How do we take it out to them? Do we use our primary care network as a decentralized distributed network, or does that confuse things? I think this proposal would enable us to do those things downstream, and frankly, even getting into regular influenza and other kinds of public health and community health events where, you know, I don't view it as the hospital taking that over at all, but partnering with public health to be a point of service that makes sense to them under guidelines that they help create.
And I would just add that within our proposal, you'll see a mobile van and a rapid testing machine. And part of that is not to set up a site that is going to be redundant to LMH Health, but is instead to offer a way for us to get out to special outbreak situations. So for instance, if we had an outbreak at the shelter, we could get there and rapidly test. So it would really serve more of a public health function of the ability to rapidly isolate and quarantine people in an outbreak situation, and not just kind of like overall with the community. And within the guidelines of us testing at KDHE, we are not allowed to charge. We don't even gather insurance information.
Thanks again. All right, now I'm going to share my screen. Russ and Sonia, you're certainly welcome to stay if you want, but I think I appreciate your help from here to talk about the community-based surveillance testing model that we're looking to put forward. I'm going to jump right into RSF2 and the recommendations for that area. And reminder that this is health and medical, and I'm going to try to stay on this screen as much as possible and try to just highlight this and keep it moving. I know we've got a lot to cover. The first organization in RSF2 was Burt Nash. They requested funding for a business interruption loan. We have had conversations with the state. Just as business interruption is something that's allowable for businesses, it is something that's allowable for nonprofits as well. Burt Nash, as you heard during budget hearings, Burt Nash has had a pretty significant downturn and their visits over COVID-19. So this would be what is not been met by their PPE loan. This would be additional funding for Crisis Stabilization Unit, PPE, for those efforts. Funds to help with their uninsured sliding scale gap for folks that they anticipate losing health insurance and the ability to pay for behavioral health services. This would help bolster that. They did invest, they are asking for an investment of $60,000 for telehealth technology, and then a small $20,000 program to help with COVID awareness and behavioral health. I'm going to keep moving down the line unless somebody indicates they want me to go into more detail. The next one is related to Cottonwood. They asked for PPE and sanitation supplies that were reimbursements of what they've already spent so far this year and what they're asking for the future. They did the same thing for some building and environmental modifications that they've had to make to their workshop and office areas. And then they had a reimbursements and an investment category for both technology and telehealth for Cottonwood. Their total ask is $157,000. And it is recommended and included at this time. I should have stated this at the beginning, commissioners. The RSF2 was evaluated and ranked by that committee. Everything was placed in a high, medium, or low category. Anything that received a ranking of medium or low is not included for funding, and you'll see those at the bottom. DECA asked for funding to help with their PPE and cleaning program, and then their technology enhancement program to provide telehealth and social work services at First Step. Heartland Medical Health Center, which is our federally qualified health center in Douglas County, it asked for a portion of their rent of their facility related to what would have been related to their amount of COVID testing that would do for the rest of the year. They have small requests in here for COVID point and care testing. Also a washer and dryer to help keep their own materials, their own linens clean and safe for their workers to use. They asked for a small amount of childcare vouchers for healthcare workers. There are funds for that also in public health and in LMH's request as well. It's important that our essential health workers have childcare to in this time. They also asked for a additional funds of $300,000 to take their existing building construction that they had planned to do before COVID-19 and to upgrade it to the separation and isolation standards and advanced HVAC needed under COVID. So that's a pretty substantial ask there that would be related to their new capital construction. And then they also had a pretty large request for business interruption costs based off of loss encounters due to COVID-19. So right now, Heartland Health is funded at just over $1 million in this plan. Lawrence Fire, Douglas County Fire Medical asked for a number of requests related to PPE for the remainder of the year, a powered air purifying respirators for EMS, personal protective equipment testing, respiratory particulate protection testing equipment, decontamination sprayers, respiratory ventilators, and UV light cleaning systems for a request of $200,000. Lawrence Memorial Hospital requested assistance with their inpatient COVID nursing unit, improve their existing respiration evaluation clinic, a drive-through access for Safe Health, which is the DASH program that they're talking about, specific surveillance testing for healthcare, human services, and first responders, a back-to-school baseline COVID testing that can be done in conversation with school districts, support for the COVID call center, public safety measures inside healthcare environments. So public safety measures they will need to continue to take inside LMH as we go, a telehealth and a telework proposal, their FEMA Part B match. And just for the folks that aren't aware of this, if there are FEMA funds available, and Brooke will correct me if I'm wrong here, but if there are FEMA funds available for COVID-19, FEMA only covers 75%.
Correct.
Of the cost. The remaining 25% has to come from the state and locality. The state of Kansas has already indicated that they will not pay their percentage of their 15%, Brooke?
It's, yeah, 15%.
Yeah, and then the remaining 10% would have always been local anyway. So this would be to cover any of their FEMA match funds. Their employee health quarantine fund is an overall health worker support fund for a variety of needs needed for their healthcare staff. They're asking for funding for their pandemic uninsured fund, and the $2.7 million that we just discussed in terms of mass community testing. We have a small project from Marla Quilts, which would be a mask making project, which is a really exciting project to help empower folks to make masks and learning about that process. And a similar project related to the Lumberyard Arts proposal in Baldwin. Public Health has grouped their requests into a couple of categories. They have a telework request for mitigation and screening. They have payroll, including significant additional staffing, both contact tracing and surveillance staffing for Lawrence Douglas County Public Health Department for the remainder of this year. There is a pretty large capital request, which includes some renovation of their existing clinic facilities to better accommodate social distancing and other protective health measures needed for COVID-19, and the mobile van that you heard discussed earlier. Then they've also asked for, and I think this is an extremely important proposal, and they were sort of the group that went together and put in a pretty large request for enhanced communication for media buys and PR firm support as we move through the next 6 months of this pandemic to help improve our public communication on this. The next one is a really great opportunity for me to talk about something I didn't talk about earlier. So we had a small request from Morningstar Care Homes and Comfort Care Homes of Baldwin City. We also received some requests that came in through RSF1 for long-term care facilities. And then we had one that was sent directly to us and didn't go through the process. I have struggled over the last couple days to figure out how we handle long-term care facilities. We didn't hear from some that we needed to hear from. We are getting different request amounts. So I actually think, Brooke, this amount, this 6,000 is actually needs to be, am I looking at the wrong tab? Okay, we need to reduce this amount from $6,000 because we have put in a request under Douglas County's direct aid plan of $225,000 that I am holding as a placeholder for long-term care facilities. I've been working with Beth Llewellyn, who is our co-lead of RSF2, to really help us come up with what the needs of long-term care facilities are. They're very busy people in this pandemic, so trying to get from them exactly what is available to them in round 2 of long-term care facilities and what their unmet needs are. We're still working to provide, so we would like to have, and we're going to put that under our banner for now until I'm able to better articulate that request. But obviously long-term care facilities are very vulnerable populations to COVID-19, and we want to make sure that they have the resources that they need to help us through the next 6 months. Then there is also what we call a universal ask for unified command for PPE and logistics, to create a PPE reserve for our community to be for the next 6 months of this pandemic. So there's an ask of $207,000 for that. That would be to secure PPE to help backstop individual organizations that have may not have secured enough PPE to get us through the rest of the year. So that's the total of 11.3 million for RSF2. You're going to see below the requests that were not funded. There were a number of requests from Heartland Health, and as you can see on the spreadsheet, we put in here the reasons why, in this particular case, why we were not able to, why we did not recommend them for funding. Hazard pay doesn't have a description because that's been one of our last minute changes. We didn't fund hazard pay in other sections of RSF2. So this request from Heartland was moved down to a lower priority. They also asked for a mobile unit. We think we've got that covered under the public health request. And then they asked for a number of both equipment and software that were deemed to be indirect COVID care. And as the commission knows, the state's going to be really careful and to make sure that any of these expenses need to be tied directly to COVID care. So there was $768,000 worth of RSF2 recommendations that were not included for funding. Any questions on RSF2 before we move on to RSF3? And so for commissioners, as you want to peruse this, you're going to have these spreadsheets and you can get to look at each of these tabs to find enhanced detail on each of these topics. So
Sarah, I have broader questions about our decision-making process. I don't know when we want to talk about that, if we want to go through all RSFs and then talk about that, or do we want to talk about that now? I mean, if we're going to go item by item, we're going to need a 12-hour meeting at our next meeting to sort of answer. I mean, I have questions about some of these budget numbers. I mean, it's just I guess I'm not saying that they didn't do a good job. It just seems like we're sort of throwing numbers there and hoping that's right. And I'm just concerned about that. I know people put these together really rapidly, and I'm feeling, I guess we're just going to talk about it as after all the RSFs. I don't, when you say, are there any questions? It's like, how could there not be questions after looking at 71 lines of requests? You know, I mean, we got it last night. I haven't read every one of the programs yet. I mean, that, yeah, I mean, that's just my frustration right now is we're getting a glance at it and we're going to have a week to make these decisions, and we're not going to bring every person back to ask these questions. And it just, it's frustrating to me. So I'm just expressing that frustration.
And I'd like to add, yeah, I mean, we definitely need to have some time to talk about the decision, the approach. I'm frustrated that we have an entire RSF that seems to be, while it's included in the state's guidance for inclusion in round one funding, it seems to have taken a very low place in our priorities. And I guess I'd like to know the kind of the conversation that was had that made that decision. And I think there's just a lot to discuss. I think it's clear that there's been huge amount of work here, and it's an impossible task to put it all together. But it's really hard to see all of this and not have been much in the loop of the direction of it. It seems like, but I'm with Patrick. It'll be good to talk. I think it's a lot to take in, but.
And I certainly appreciate that. And I do think, like, I mean, we can move as fast or as slow through this if you want. We don't even have to make it through all the RSFs tonight if that's not what the commission wants. So we stand at your pleasure as to how you want to review this. But I did want to pop up here, you know, I do know that this is, trust me, no one is more frustrated about the amount of time to do this than me, and every other county in the state of Kansas. So we were given 30 days to put together a program. So, and I've heard it from throughout our community, and I feel for them, and we are all singing from the same choir in terms of not enough time to do this work. And I have shared with the commission this guidance from the state, and we have talked about it in the past, that the large majority of what is eligible under our CRF funding was related to health, public health and medical expenses. So it was our direction that those should be a high priority in this process. These are the only funds we have here at the local level to ensure that we have public health funds available for the rest of the year. There is no funding necessarily coming at the local level in round 2 for medical expenses and public health expenses. There are abilities in round 2 for economic impact and education. Now, certainly if the commission would like to change the priorities, that's why we're here, and over the next week to change that approach. But it was the recommendation from staff that medical and public health and our housing and human services should take a high priority.
And I would say, Sarah, that so that's interesting that you say that, because if you break down what the requests were, you know, if you just break down the requests by need, don't even worry about what's recommended and not recommended. Support function 3, it wasn't anywhere close to that. You know, I mean, the human services area requested a whole lot less. Is that because in Douglas, I mean, one interpretation is because Douglas County does a really good job as a county of supporting human services, because the guidance we're getting is from the state of Kansas. And I don't know that every community supports its human services like Douglas County has. I mean, if we were hearing from these sectors that they were as desperate to, we would have received, I mean, don't you think we would have received the same amount of funding requests from health and from human service and housing as we would have from healthcare?
No.
You don't think so?
No, and I'm certainly willing to let Jill chime in here with RSF3. No, I think that certain groups were more strategic in what they asked for. I don't think just, I think some folks, frankly, in certain RSFs aimed really high and thinking they weren't going to get that. And so that they needed to ask for a really high amount to get some. That's also a different interpretation as to how folks could have approached the work. So, and I would say inside RSF3, there are CDBG funds and emergency shelter grant funds that have been secured by the city of Lawrence to help with some of those efforts. So the amount of funding that we've already received as a community will be targeted towards RSF3 functions. So we have not received any federal funding for health and medical and public health related expenses. So that's more my view on it. But certainly there are places that if the commission wants to, sort out a little bit different so that we can realign funds, that's what we're here for. And like I said, this is a rough draft. And I fully anticipate what the commission sees next Wednesday on the 12th will not look exactly like this. And that we will have moved some priorities around. Like we said in this memo, our priorities were based off of potential future funding, which both economic impact and education have coming to it through next rounds of CARES Act funding. And based off of this guidance that it has to be spent in this year. And these are the funds that we are asked to have as a community to be able to respond to COVID for the next 6 months. So I'll turn it over to Jill for RSF3. Jill, do you have it ready for the screen, or do you want us to run it?
I should be able to.
Right.
Just a second. Okay. All right. Well, I have gone to the summary page of the handy dandy master spreadsheet that Brooke put together. And what you see before you is the list of highly ranked requests that RSF3 received and recommended. And we're given the high, medium, and low. These are the highs. Just so you all are aware of how we made our decisions in terms of rating these as high, medium, and low. Well, let me back up even further than that. One of the questions that's come up in recent days that we've had to clarify a bit more on is how did we promote the availability of these funds to our human service providers? We did 2 webinars that was opened up to the Human Services Collaborative at this co-hosted by the United Way and Douglas County. So we did 2 webinars that were very well received, high participation rates. And I know that myself and a lot of the folks on the team fielded a whole lot of calls and questions about from different organizations trying to suss out whether or not a project or a program would be a good fit or not. So the other way in terms of how we rated our requests, in the cover memo that Sarah provided you with that gave some background on how decisions were made, the focus areas and decision-making background on RSF3 was provided in that. And we laid that out at the beginning of the recovery support framework stage when that started after Unified Command stood down and the RSF structure started. We put together those focus areas, and that was the guide book for how we did our work. And that was before we had CARES Act money to administer. So I felt really good that Shannon and myself put that together, and we had shared agreement among the RSF stakeholders in that group, which are represented in the requests that you see before you, but also there's organizations that are participating in the RSF3 that aren't represented on here, but gave the thumbs up that these were compelling requests, and the highs deserve the highs, the mediums deserve the mediums, and the lows deserve the lows. We had Maybe a couple questions amongst our larger RSF3 group when they reviewed all this. And I was, kind of surprised that we didn't get more, but we had their support to move forward and present what you have to you today. So how we made our decisions, when you look at the cover memo and those RSF3 focus areas that were listed in there in Sarah's cover memo, those 5 focus areas are, the first one is housing stabilization and homelessness prevention. The second one is focused on supports for congregate site shelter environments. The third is support for feeding organizations, food supports. The fourth is supports for our unsheltered homeless population. And the fifth is around digital equity and inclusion. So the first way we evaluated those requests is the first, did they fill out a complete application, including the equity impact analysis? So if they didn't fill that out, then they didn't make the cut, but thankfully all of ours did. The second line of review was, did it fall into any of those 5 focus areas? And if it did, then they received a high rating. And then the other it's not really reflected in any of our materials, but those of us have been, Shannon in particular, my colleagues in the initial review for RSF3 were my co-facilitator, Shannon Oury, the executive director of the Lawrence Douglas County Housing Authority, and then our 2 equity advisors for our group, Kara Smith, who's a teacher with Lawrence School District, and Leah Roslin, who's the community impact manager for the United Way. The 4 of us spent a considerable amount of time reviewing the requests and rating them, giving them an initial rating, and then we sub-rated the highs to have a priority ranking, which is what you see before you today, is reflected in what you see before you today. So what we observed in our ratings as well was, were the organizations that were making requests actively engaged in the response to COVID-19 throughout even the Unified Command response? And many of these were, or they were asking how they can help. And I think that's compelling. So those are the things that we thought about when we rated these. So I can quickly walk through some of these and answer, I know I understand this is overwhelming, and any questions that you have about any of these requests after tonight, I'm happy to take a phone call, answer questions, emails, happy to go through it. And then one other thing I wanted to share in terms of, Sarah mentioned the Cdbg funding. A lot of these agencies had access to Douglas County Community Foundation funds, a wonderful partner throughout the Unified Command phase of our response to COVID-19. And so I want to give a huge thanks to DCCF and the work that they did to support a lot of these organizations. And I think that there were also organizations that applied for Kansas Health Foundation funds, things like that. So real quick, Artists Helping the Homeless requested funding for capacity excess sheltering for homeless individuals when there is no capacity at any of our other providers. During COVID-19, CDC, all the homeless care providers have best practices. You want to get folks off the street. You want to try to use that opportunity to refer them to a coordinated care approach. So Artists Helping the Homeless, and then you'll see later on in here, the Lawrence Community Shelter, they'll be working very closely with our partners at Harlan Radak to make sure that we're referring them on to a better opportunity, hopefully. Ballard, this is to provide just additional support operations for the families that they're working with, just kind of a foundation to what they do. Catholic Charities, eviction prevention, so anything from rent assistance, utility assistance, understanding what are some of the barriers that families are experiencing that could be the trigger to eviction. The DARE Center, this is the Downtown Drop-In Center. They had a small request just for basic things that they'd like to provide individuals that are out on the streets. So sleeping bags, food, hygiene supplies. DECA, a majority of DECA's request was referred on to RSF2, which Sarah covered, because it was more appropriate for RSF2 to review and consider. And so we did refer that on, except for this one. And this is to provide housing assistance to the individuals that are being served by First Step, but because of the requirements around social distancing, they are not able to safely keep them in DECA First Step, but they want to make sure that they have access to some sort of next safe housing step to keep them safe in their recovery. The next one is the Eudora Giving Garden, and this is a community garden project in partnership with the Senior Center initiative that Mary Kirkendall has been spearheading in Eudora. So this is to help initiate a community garden project that they hope to be able to sustain as a community after this year is up. The next two are from the Douglas County Extension Office, and these are reimbursements for some of the work that they did following COVID-19. And I would say, you know, Extension Office in terms of like providing assistance and referral for food supports and food assistance, SNAP benefits. There was a significant expansion in SNAP benefits. And the Extension Office with Susan Johnson and some of her team making sure that we had a comprehensive list of all the food pantries and all the resources that were available to families. They were just really integral to that. So these are some of the reimbursement requests that they submitted. Just Food, we talked to the commission a couple times throughout the Unified Command Response to COVID-19 about some of the needs that Just Food had. The commission approved providing some supplemental supports funding to Just Food prior to where we're at now and to the time frame that's in front of you. But Just Food had submitted requests to help supplement their operations budget for food purchases from September through December of this year. Because I think we shared this with you before, because of the pandemic, they are not going to be able to have some of the fundraisers that their operating revenue relies on each year. Second request from Just Food was significant capital improvements to their facility that will allow them to be able to safely have volunteers in their space, in their warehouse, and rehabilitate it to the point where it is a more COVID-friendly environment, plain and simple. And they can continue to operate at the capacity they've been operating at throughout the year, throughout the winter months. A lot of Just Foods operations were moved outdoors in the summer, and that was less than ideal given the summer heat right now. But they're working their way through it. But these capital improvements will, which they do believe that they can complete by year end, are going to be significant enhancements to making their facility more appropriate for operating in a COVID-19 environment. The next one is a request from Lawrence Habitat for Humanity to provide mortgage assistance. It's plain and simple exactly what it is for folks that have been impacted by COVID-19, and whether it's their employment, whatever that is. The next three requests are for LCS. You see a request to help them with supplies, PPE, cleaning materials. The second request that you see is for capital expenses, and these are capital expenses that were not able to be included in the Cdbg funding recommendation that has already been recommended by the City of Lawrence, and we're working through the process right now of hopefully being able to put the LCS in a position to put that portion of the project and this portion of the project out to bid here soon with the help of our capital projects manager, Jay Zimmershed, and the Cdbg team at the City of Lawrence. We've been working very closely with one another. And again, we think we can get this work completed. LCS thinks they can get this work completed at the end of the year and make that facility more appropriate to operate in a COVID-19 environment. And then the second one is to provide, because the third one for LCS, because of the COVID-19 environment has limited the capacity at the Lawrence Community Shelter. They are turning away a lot of folks, and they would like to have the flexibility to put folks in hotels for 3 to 5 days to do to provide some problem solving time with our partners at Heartland Radac. I think the funding for this request may be rolled into a larger, some other requests that the county has with some of our other partners to do something similar. And we may be looking at this request on a reimbursement basis, similar to the funding that the commission has approved for a lot of our congregate site shelter partners in instances of isolation or quarantine needs that we've been reimbursing the shelter on for the past month or so. Our next request comes from the Salvation Army. This is for the first request is for emergency assistance and programming. This is largely for their food pantry operations and how they can get that facility operational. Salvation Army relies on a lot of volunteers. Volunteers they're having a hard time attracting volunteers right now. So this request includes some support just for some basic staffing to help them make ends meet with what is a very, very small staff. But the demand on that organization at this time is significant in terms of the food pantry. They want to keep it open and they want to keep serving folks. The next request is emergency assistance, and that is to expand the emergency assistance funding that they already provide to individuals through the Emergency Services Council funding that the county helps provide funding to each year. So rent and utility assistance. That is for that one. Fourth one is for reimbursement for PPE and other expenses that they've already incurred prior to the end of July. And then the last one is for some capital improvements that they'd like to make, a couple air conditioners for their food pantry space, a conveyor belt system so that the 2 staff members that work in the food pantry can safely transport the food and all the large boxes and pallets and a pallet loader that they can use to move all the food through the facility in a safer, more efficient way. Again, without having the high numbers of volunteers that they're used to having. Moving on to a request from Tenants to Homeowners. This is a request for them to be able to renovate 3 homes that are currently vacant. But if they can rehabilitate them and get them up to a more habitable state, then they can be rented out and by Tenants to Homeowners to families that have been impacted by COVID-19. The next request, this is a collaboration with the Tenants to Homeowners and Family Promises, which is the Housing Stabilization Collaborative. That's what that HSC stands for. And this is to that $850,000 that's assigned to that is to provide rent assistance to families that, the number that is targeted is 200 families that have been impacted by COVID-19. And if you look at the detail of that request, it's targeted to folks that are at a different income range than some of the folks that we traditionally serve through our emergency assistance funding, that through the Emergency Services Council. These are folks that, but for COVID-19, may not be in a situation where they're facing eviction. The next few support requests you'll see here is for the United Way. Throughout the Unified Command response, the United Way stepped up and provided, they staffed the volunteer center and the functionality and the donation side of our Unified Command approach. But the person that performed that function is a part-time position, and to be able to continue to provide volunteer assignment and supports on a community basis to our different partner organizations and accept all the donations, they're going to need some more support to get them through the end of the year. The next request is for community resource navigators, and these are individuals that will be placed at our community libraries including the City of Lawrence, Baldwin and Eudora, to provide exactly what resource navigation, to physically talk to individuals or over the phone and help them navigate, where do you find rent assistance, where do you find utility assistance, where do you find food supports. It's a need that we've been discussing at the Human Services Coalition for several years. And so we're going to give it, they're going to give it a test run with these funds, and hopefully we can sustain it with some of our partners in the community after this, the end of this year. The last request from the United Way is for school supplies. Traditionally, the United Way does a fundraiser for school supplies for needy families, and they're struggling with donations this year, but they feel that the need still exists, that families are still going to need supplies, but there's still some uncertainty around what the school environment is going to look like. Let's see, Van Gogh, they requested funding for PPE future expenses. And then the last two that you see here for the Willow Domestic Violence Shelter, and this is for housing placement and shelter in place functions. And this is largely so that they can continue to house and safely shelter individuals that they're not able to, they don't have the capacity to serve at their current facility because of COVID-19 social distancing and the way that their space is set up. We heard consistently from the Willow throughout the response to COVID-19 during Unified Command that the number of domestic violence calls was ever increasing, and the demand on that organization and our community providers like the Lawrence Community Shelter was significant. And so this is just problem solving funds for them. And the last request that received a high rating was from regarding PPE and cleaning supplies for the Willow. There are not a lot of items listed below that didn't get funded, but they did get a low that got a low or a medium rating, and you can see those here. And I'm happy to answer any questions related to those. But again, these were presented to the full RSF3, and there was agreement and support to move these recommended projects onto each of you for consideration today. I'm happy to answer any questions.
Jill, so this sort of riffs off my earlier question to Sarah. You know, this number is, the request number from this group seems much lower than I would expect. When I saw this number, I was just shocked. Can you maybe give us an impression? I mean, do you think that was just really careful thinking about it? As Sarah was saying, is that this group just worked really, really hard to make sure they were asking for things that, are you understand what I'm trying to say? Or were they really focused on making a request that they could actually fulfill, and, you know, that the numbers were really sharp?
So honestly, I credit a lot of it to our RSF kind of having a framework in place from the beginning. We multiple times gave to, I think Robert and Jillian and Brooke and Sarah can and Daviana can back me up on this. Multiple times, I said to the RSF leaders, which includes all the folks from Unified Command, are we on the right track? Are these the things that we should be organizing our efforts around? And they continually said, yes, this is what we should be, this is what recovery looks like for this RSF. Keep doing your work. And so honestly, I think that was a good first start. I think that a lot of the organizations that you see here, getting the work done by end of the year was part of it. And then not setting their organization up for having that revenue drop off at the end of the year. You know, we gave close counsel on, you know, these are one-time funds. So, you know, how if you want to support staff, think very carefully about that. But one of the things we also talked about was, you know, the priority, where the priority funding was, that Sarah covered in her cover memo. We reinforced that these are the priorities that we have for these funds, and this is how much we have. So we made them all aware of how much we were working with and that we had to prioritize those. And I really feel confident that a lot of these organizations are very supportive of, in particular, making sure that RSF2 gets covered first, because they all benefit from RSF2 being as supported as much as possible. And I mean, and a lot of that is credit to the health department and to the hospital, because they have been invaluable partners to virtually all of these organizations throughout our response to COVID-19. I don't know where we'd be without those two organizations and their staff. So I think there was comfort that they had that would be taken care of. You know, that's my impression. And they're not for profits. They're used to operating really efficiently. So that's my impression.
Okay, thanks.
Sure.
Moving on to RSF3, well, Robert is going to walk us. Sorry, boy.
That's all right. I'll stop my share.
Okay, so we're gonna get him uploaded for education. I do want to say one thing I didn't talk about when Commissioner Kelly asked that request about like how solid are the numbers. I think in some places, if you look at each tab, I mean, there are pretty decent budget estimates on many of these tabs, what these are based off of. Do I think that there is, but we did counsel folks to give some flexibility in their program design. So, you know, so that we can use these funds over the next 6 months to really meet the need of the community. So I feel pretty and I will tell you, yeah, I mean, our team is I'm going over every tab. Brooke's going over every tab. Each group is going over all their tabs to make sure that what we have for you on the 12th is really scrubbed to make sure that we feel that those estimates are as solid as we can do in such an abbreviated process. But that doesn't mean that in some large, I know you're giving me a look, but I mean, I guess I would say that like, well, that doesn't mean that like, let's take, for example, the LCS hotels request. If they have not spent remotely that much money over since March. Could we reduce that request? Yes, absolutely, we could reduce it. So I'm not necessarily, I'm thinking there is some room in some of these, but I think there are a number of these tabs, there's quite a bit of detail in terms of where the numbers came from.
Yeah, I mean, we could go through every line and probably argue about, I mean, yeah, I don't want to nitpick, but I'm not sure I agree that every line in this budget, or even the majority, I don't know that. Anyway, I won't say anything.
I didn't say every line, but there is a lot of detail on back tabs, and we will continue to review them over the next week. That being said, I'll turn it over to Robert. And Robert, maybe it would be helpful for you to start off with some of the background around prioritization here. I know this group really struggled, and also we're struggling. What's happening in education is ever evolving. These folks prepared these requests before the governor's order to delay school till after September was even voted on, and then rescinded. And then so this, if you want to talk about a moving target, I really do feel like the education RSF has a lot of moving pieces to it. So with that, I'll be quiet and turn it over to Robert.
Thank you, Sarah. And can you guys see my screen? Is it up? Okay, great. Good evening, commissioners. Yes, a little bit of background. RSF4 was led by, or is being led by representation from 497 and also from KU. And so they worked hard. They worked hard together to get their proposals submitted. However, in the late hour, they were unable to come up with a strategy to prioritize their proposals as a group or being collaborative. So having said that, we received, Jillian and I received their proposals based on their individual prioritization for their organization. So that's what we got late Friday and had to work with. And so we had over 7 million total, and it's, you know, through our process came to 3.8 million. What we did, because of lack of a way to prioritize, we based our decisions on safety or prevention of spread of the disease, equity, and an increased need for childcare. And that's what we, for the most part, based our decisions on as we went through this. And so I'll tell you, a lot of what you're going to see on there is PPE or distancing measures, things for those kind of reasons. And what I think I'll highlight for you tonight will be the things that are not PPE and maybe that are a little outside of PPE. So Boys and Girls Club, questions about the process before I go through this and how we got here.
So Robert, are you saying that, so they had no process for high, medium, and low at all?
They had individual processes for each school district and organization, but as an RSF together, they weren't able to prioritize all of it to get like they did in the other 3 RSFs. So what happened with the others is that, they received them with those high, medium, lows collaboratively from the whole group. All the represented agencies did that, but we didn't get that. We got it individually prioritized.
And you didn't share that information. I mean, that's not on here, right? We didn't get what they individually prioritized, right?
Is that in their packet? You're muted.
Have it on the tabs. And we can certainly get that to you, Commissioner Kelly, if you'd like to have that between now and next week.
Okay.
So on the tabs, is that what you just said, Sarah? It's on the tabs?
Well, I think so, but let me check. So if it's not, we can get it to you.
Okay.
So Boys and Girls Club, they obviously PPE, but then going into their in-person learning response plan is, they see the gap that they're going to need to fill with childcare, and as part of that gap is going to be assistance in learning, especially if there's a hybrid model. So that's what you're seeing there from Boys and Girls Club. Childcare Aware of Eastern Kansas. That first one, financial aid, that's a line item that's for individual parents that are in need of financial vouchers to gain childcare for their families. The Hero Relief Program are grants and sustainability grants for individual childcare businesses, if you will, to help one, sanitation and clean, and as well as whatever materials and supplies they may need to sustain. And that was actually a double that 397,000. We recommended half of that. And then the technology and support grants are specifically for those childcare facilities who need help in connectivity. So they know they're going to have children that are going to need to possibly remote learn. And so they're anticipating some need in technology supports. KU, Campus Cup Board, they have, because of their staffing issues, they are asking for some funding for their Campus Cup Board, which is their food bank, KU. That building operations is a rental possibility of Naismith Hall to have further isolating opportunities in the event of an outbreak or spread. Dining support is they are not opening the KU scholarship halls in the fall, and in doing so, some of those people who typically have meals provided to them as they are part of the process of preparing those meals and cleaning those kind of things in support of it. So what they are asking for is support to help fund those kids going to the KU dining hall in lieu of the scholarship hall. The health monitoring app is a locally created application for self-monitoring, and these are kiosks that would be at entry points of buildings that they would scan, and it would be able to pick up and let them know whether they're allowed access or not based on their individual health situation at the time. USD 348, Baldwin, again, which you'll see on-site learning and 2 different line items there besides PPE, and those were basically for underprivileged technology for those both, you know, at the school and as well as in the home in the event of hybrid or totally online learning. So they were looking for assistance to help those students. And then we go into 491 and amplification systems for having an opportunity. And this is going to be common through some of these others where they ask for systems to be able to amplify as they social distance and as they set up larger areas. They want to have a way for teachers to amplify and teach. So the rest of that's pretty self-explanatory. 497. I will say that and when we get down to the bottom, you'll see there's quite a bit of technology that we didn't recommend, but there's just some in here for mostly underprivileged. 497, similar technology on site as I said about the other districts. Social emotional support, behavioral health needs, increased needs for kids and staff, and yeah, technology both on site and off for the same reasons. Baker, PPE, Bishop Seabury, same with those private schools, just sanitizing and PPE. A few of them. O'Connell Youth Ranch, because of you know, distant learning, they have very old equipment and they don't have the capabilities to teach distance like they will or possibly will need to. So that's their ask there. And Veritas, again, health and safety, which is basically PPE and sanitation. So you can see there we came recommending 3.8 million. Below you'll see what was not in our recommendations. The private schools there asking for technology, a desk, they're asking for furniture and those kind of things. And then KU, peer educator, signage for to help with routing students, I should say, students to help social distance, outdoor education space. That was an ask for tents. Apparently they're doing that anyway. To instead of having congregation inside hallways and buildings, they're going to ask them to be at various locations outside of buildings to be distant. 348 asks for staff. You'll see nurse aide, custodial. Some of those are actual asking for staff funding. And 491, some air purification systems, which we stay consistent across all of the requests. We didn't recommend. Technology, you'll see 497, it's listed at the bottom there, but that next yellow block is 497. You'll see quite a bit of technology in there. And then Veritas, they actually wanted some capital projects to make more space to distance their kids and have storage, and obviously technology for well, Success by Six. I was looking for this iris system, which I'm not real sure we could tie that to COVID, and Baker University technology. So those are the things that 3.7 there that we did not recommend in this proposal. And I would say I'll stand for questions.
Robert, question about, you said electronic air purification systems, but we've seen that included in like city air. I mean, we're talking people want to replace it. It looks to me, and I know they've spent a ton of time on this, so I'm sure I'm missing something, but it looks to me like some organizations are wanting to replace their AC, their air handling. And I don't understand enough about, this is my frustration, is that I don't understand enough about what they're wanting to do to be able to determine, to make a value judgment on some of these things. And I hear, well, we didn't want to do air purification systems, but we did, it seems like we did in other buildings. So maybe I'm not misunderstanding what air purification systems mean.
And,
Yeah.
and let me step in and correct Robert a little bit. Actually, we do have air purification systems in the direct aid plans for municipalities. So we did not include it in the education. So that's something we can go back and look at if the commission wants us to be consistent and add them back in or add them back out. What I will tell you is these are not generally full replacements of HVAC systems. They're additional filters, filtration systems, and UV systems to help filter out additional particulates and to use UV light to kill particulates that could be in the air. And I'm certainly willing to bring in, you know, the problem is everybody kind of picked something different. I am also not an HVAC expert, but we could, I mean, I'm certainly willing to do more investigation and bring that back to the commission so that you can make a better analysis of that.
I guess I'm mostly using it as a point of discussion, you know, that this is, we don't usually manage organizations' budget down to the line item. That's not, you know, that's not usually what we do. We give them budgets and let them work within that. This is unique.
Yes, and I would say that the hard part here is that it's very important that these be eligible expenses for coronavirus. So I can't just say, you know, USD 348, here's $200,000, go to town. It has to be something that's eligible for what they want. I do think we can try to put some flexibility in there that they can use it. We thought the commission would want to know specifically what we were funding, and so that they could use that to help inform the decision making of knowing that we have 15 million in requests and only 25 million available to fund.
You've already eliminated all of those requests which you feel are ineligible, correct?
No,
No.
they're not ineligible, just in an effort to come from 50 to 25 million. And that's kind of the logic there. The only thing that really is ineligible that we thought here is potentially this IRIS system, 6x6. Everything else is eligible, so, or it appears to be.
I do think that one thing that's important here on education that I want us to think about over the next week is, because this framework is ever evolving, you know, districts and organizations were asked to put in proposals on, you know, we basically said, put in whatever kind of proposal you want. And things have changed. We could try to make these funding recommendations more flexible in terms of, if you decide to stay all online and distance learning, maybe you don't need as much PPE and sanitation. Maybe you'd rather have that for distant learning supports. We can make that flexibility in the plan if that's what the commission wants. I do think it would be important to go back and look, though, at the total size of requests. So, you know, at the risk of throwing out the entire ranking prioritization process, which I am reluctant to do at this stage in the game for education, you know, we could look at a different model that gives school districts maybe per pupil some sort of flexibility inside the framework. But I just want to, I mean, I feel bad, that's not the way we proposed it, but it may be what's best as we move forward. And if the commission had kind of, if that's the commission, the direction the commission wanted to go, we need to talk about targets and how that would work. But I mean, I feel for folks that ask for PPE and sanitation equipment, and now they're going to be all online for at least the first 6 weeks. You know, so we can certainly continue to evaluate this. We want to make sure these funds are used and used appropriately by the community. So we're going to move on to RSF1. And I'm going to have Daviana walk you through it. But I want to say a few things as we get started. This area had probably, I mean, I think from the way I look, it's the second largest ask and the least amount of funding allocated towards it. That was really based off of our stated priorities of health and medical and testing. And then there were a number of complications with how some of the requests came in that I think are reflective of what I said earlier about this being a rough draft, and the fact that in order to get it before you by Wednesday at 5:30, when projects were received Monday morning and had to go through a recovery committee, that a knife was used to develop this rough draft as opposed to a scalpel. I am fully aware and prepared to go back in and use a scalpel to talk through particularly this area and see what we can do. I want to say a couple things at the outset about this. I'm going to pull up, actually, Daviana, before you do that, I'm going to take your screen. And I want to go back to the prioritization recommendation that was included in your packet, which shows the priorities for round one that were stated by round one. And they stated up front on their public application site, their top priorities were food services, arts, entertainment, accommodation, personal services sectors hit hard by COVID-19 and that will take the longest to recover. Small businesses under 100, locally owned operated businesses, and the highest priority being placed on applications with a direct tie to expenses for the adaptation of COVID-19. So this is what they walked into this prioritization process with. You're going to see some on this list that don't fall into this criteria. And so those were ranked low. Daviana, I'm going to let you put it back up. And you're going to see, in addition to this, I think this group took the equity impact analysis very seriously. And folks that completed their equity impact analysis that indicated that our second largest industry in Lawrence and Douglas County, which is restaurants and hospitality, does employ a number of low wage and oftentimes disproportionately impacted minority populations in the food service and hospitality industry. Those that completed their equity impact statement to indicate that ranked higher. So what you have here is there were a total of $908,000 in requests for restaurants, not included in the Lawrence Restaurant Association request. So $908,000 in requests. You see 3 restaurants in here that are included, that made the funding gap from RSF1. And you see a lot of restaurants that didn't. That was largely based off of how they completed their equity impact statements. Now, as this comes up another level and comes to the county as a whole and the county commission, do I think it is equitable to completely, to fund 3 restaurants and not others? No. However, I felt it was important to honor the integrity of what RSF1 gave you up front in terms of recommendations. Does that mean it needs to stay this way? Absolutely not. So we have time here to talk about how to evaluate that. In addition, the Lawrence Restaurant Association requested $3.3 million alone to fund 3 different sets of initiatives. That was 13% of our, I think that's 13% of our total. Given our overall priorities for health and medical, it was not something that we could remotely accomplish. Now, and their largest ask was for $900,000 in surveillance testing. As you heard earlier tonight, we're hopeful that the $2.7 million and the protocols established by Lawrence Memorial Hospital Health, and the Public Health Department will accommodate those surveillance testing models that we need moving forward. So that request while it was ranked high initially by the group, we withdrew it because we knew we had a large request sitting in RSF2 to fund community-based testing. And then I'm going to talk to you about, and then they also, so I'm going to talk to you about some of the ones that got pulled out. And I'm going to let Daviana work through the ones that got in. The other two requests from the Lawrence Restaurant Association that were not included, that one of them else was ranked high, and it was for an economic stimulus program that would have been a significantly larger expansion of the Restaurant Association and School Feeding Program partnership that happened earlier this year, that would have had Restaurant Association members preparing meals at $15 a meal and distributing them to the community through Just Food and Meals on Wheels. As you have seen in RSF3, we have significant funds included in this program for community feeding at a much lower price point. And we felt like it was a better idea to have our funds go to community feeding opportunities set up through RSF3 than it would be to do this, expand this particular program. Does that mean that we don't need to do economic stimulus for restaurants? Absolutely not. Do we need to sort of complicate it by having it be prepared food to go to Just Food to deliver as opposed to just a flat out restaurant subsidy program? I think there's a simpler way to do this, but in order to make an impact on restaurants, that amount of the ask is going to have to be substantial. I think in the neighborhood of $500,000. As you can tell, cuts in these areas are going to be hard to come by, but I do think, and I had a conversation with Emily Peterson with the Lawrence Restaurant Association earlier today, and we talked about this, that I think that there's, this is an important sector in our community. We need to be in a better place on that particular ask this week or next week when we come back to review this, but I'm going to need some guidance from you as a commission as to how to approach that work. And then I want to say one other piece, and I'm going to let Jill chime in here if she wants to. We had a very large ask from Explore Lawrence for a hotel aid program of $726,000. The hotels, the detail tab includes the hotels that were included on this ask. None of those hotels were hoteliers that were willing to work with us during Unified Command the first time around to provide assistance and housing for our congregate living providers in the first round of this initiative. And that was a very large ask to support an industry that we really struggled to get to work collaboratively with us as we approach the need that we were willing to pay for hotel beds for congregate living needs. Does that mean that that group was not heavily hit? No, they were heavily hit and they were heavily impacted. So is that an area where we could go back and explore? Absolutely. Like I said, we had to get from 50 million to 25 million in 24 hours. We had to use a knife, not a scalpel. And so now we have a whole week to try to build a better proposal. There's a reason why I asked to review this one last. It needs the most work. And so I wanted you to see, though, before we got to this point, how important many of the things outlined in 2 and 3 are, and how that led our decision-making process. We knew coming into this that economic impact was going to have the lowest amount of funds based off of the criteria and prioritization given to us by the state, and the ability for these folks to access funds in round 2. Now, I know that's a moving target, and I know that that's no guarantees, but I feel like I'm trying not to be defensive of where we're at on this RSF, but at the same time explain where we are at on this RSF. So with that, I'm gonna let Daviana walk you through the proposals that were recommended for funding.
Thanks, Sarah. Good evening. It is evening. I think, thanks for letting me speak on RSF 1. Sarah has really done a good job in detailing the places that kind of the recovery team as a whole has determined, you know, could we redirect, could we take, where we took a knife, could we take a scalpel instead and kind of carve out somewhere else and probably work on some more collaboration and cooperation with agencies that have submitted funding. So I'll kind of go hit this high level category. As Sarah mentioned earlier, we're really looking at right now requests that have been classified as high priority. So kind of starting here in the blue, we have the Community Foundation. They have requested basically funds for a grant program for 5013Cs, just allowing them to further give grants out to small businesses and agencies to assist with their recovery efforts in that capacity. The second is basically providing hand sanitizer to healthcare professionals, schools, government agencies, and the general public to kind of provide that PPE support there. The third request we have from Lady Bird Community Kitchen. That is basically them providing food meals to those that have some food insecurity, especially as we move kind of further into, you know, this global pandemic where I don't think we're in the place that we thought we'd be at this point in time. And so food security is becoming still an even increasing issue. And so Lady Bird kind of wants to help bolster what they've already given out while they've been closed and supplement some of their meals that way with this CARES Act funding. Next, we have the Peasley Tech. This is a program that they have already started in order to raise the income, security, and equity in Douglas County. This program is to help those who were kind of furloughed from their, you know, trades and the jobs that they do. And this is providing them the ability to go to Peasley Tech, pick up some more job skills and to learn a different trade. So and then they're able to hopefully find placement elsewhere in the job market and kind of boost the local economy that way. Now, as we're getting here to the 23rd Street Brewery, this is once again hitting that PPE line that we're seeing a lot and following those criteria that RSF1 and the state has laid out with small business hit the hardest. They have these significant PPE crisis issues. So that kind of what placed them at the top categories as high. And all these, as Sarah mentioned, all these programs so far in the high category really hit on that equity piece. RSF1 really ranked equity significantly, and that can kind of be seen in the notes column. As we go down that, you can see we get to the place where it's not advancing equity as much or partially advancing equity. So these higher programs are doing that completely, or at least to some level that RSF1 felt comfortable ranking those higher than others. Similar to Lawrence Beer Company, they put in a request with Lawrence Restaurant Association, but they also have some non-covered expenses that they would like assistance with that. Once again, hitting that PPE for restaurants. The same thing with merchants. I think we're starting to see a trend with PPE, trying to shift from having in-restaurant services to only doing carry-out or takeout. We're seeing a lot of that as they also, I think restaurants are trying to grapple with how downtown looks now when it compared beforehand, how you can't really sit in and dine in restaurants. And then finally, what we have ranked as high that kind of stayed at the top is with the Lawrence Arts Center. This is what we've seen has been one of the hardest hit economies for Lawrence in Douglas County. As we saw, I think last week, as they showed last week that they were struggling, this community was struggling, they put in a request to help supplement the arts and cultural heritage that would typically be found in K through 12. And so in order to supplement that kind of loss with, art classes and different cultural classes with the museums and things like that, to kind of supplement that as we move towards kind of, shifting away from in-person classes. How can that, how can that economy, how can that industry recover, moving from, having those solely in-person interactions, and how can we still, help them with that? You can see a note here that originally it was labeled as distance learning. However, the state has classified that distance learning is pretty much exclusively used for public schools. So luckily, we were able to get in contact with that group who, put forth that proposal saying, it's not a concern. It may not be a concern right now at the local level, but however, when we get to the state level and the state is more careful about, what programs getting funded, it's important that, this is a sector, this is the industry that's really hit hard, and we want to do what we can to make sure that, the livelihood and longevity is still there. And I'll kind of touch on a couple of these first 3 that we see here by the Lawrence Restaurant Association and Explore Lawrence were the ones that Sarah mentioned. Although they're ranked high, they were not recommended by county staff and the recovery team at this time. And as you can see, Sarah also mentioned that there are just numerous restaurants who were not given a high rank and were not recommended funding wise. We can kind of see just different economic sectors here. And this goes on and on and on a little bit. And so this was eventually $9 million in unrecommended requests, non-recommended requests. And then these programs at the very bottom were just ineligible in total due to incompletion or ineligibility due to they did not meet that standard of directly related to COVID. And so that was a little over $500,000 in requests. So overall, RSF 1 had a little over $11 million in requests. County staff and RSF staff and RSF coordinators and leaders got that down to about $1.2 million. So what questions do you all have? I know there's questions.
Questions, commissioners?
Well, I don't have, I have a lot of questions, but I do think that I'm relieved to hear it very clearly expressed that this program, this RSF1, needs some work. I very much appreciate how hard this task is, and it's especially difficult when we're asking individual businesses to put themselves out there and ask for money, knowing that not everyone's going to get some. But I'm super concerned at, frankly, the equity of, the how much need there is and how few places are seeing any help from this. And I think definitely there were some huge asks, and some of them may have already been taken care of by the Lawrence Memorial proposal. I just think need to really sit down and take a long look at this and try to think of a strategy, because I just feel like this is pretty far from what I was thinking, and frankly I'm concerned that we have a whole sector that is hanging on by a thread. And I know that there is the hope of funding in the round 2, and I need to understand more about that, but this is the round that we can control. And so I guess I want to take a long look at this. And Sarah, I'm glad to hear you say that you see some ways to rearrange or work on this a little more. And Daviana, thank you so much. I know this is really hard. That's an awful lot of requests, and not, the money is just a drop in the bucket compared to what's needed. But thank you for your work on it. I do have one question. The equity toolkit, that test, did every RSF, the 2, 3, and 4 RSFs have, I know each team had an equity angle. Was there an equity tool applied to those RSFs as well? Is this the same tool or the same level of scrutiny?
Yeah, Daviana, why don't you pop up that the compilation of the RSF's equity tools, so the commissioners can see what we pulled together. I do believe we asked each group to include this in their evaluation process. Now, given that RSF4 didn't rank theirs as a group, you know, I think they may have used it to rank their individual projects. And then, you know, I think we could go through each area and talk about how it's used.
Okay.
And I just want, and we will send these to you as well, and we will make them available to the community as well. So there are over 200 pages of equity impact reports on each program. The files are longer than that because every file is a 2-page document, but there is an equity impact, and we have them labeled if Don Viana can show you. So like right at this one here, you can see that that's RSF1 1A, and that's their equity impact report. So at the top of each of these, you can tie that back to a tab.
Yeah, so for each kind of hyperlinked number that you see here, it's tied to this combined equity sheet. So for example, DCCF's is this 1A here that you see. And as Sarah mentioned, each RSF, each program that was submitted to each RSF was required to submit this same equity impact analysis tool that was created by the equity impact advisors. And if they did not complete that tool, they were ineligible. And they had an incomplete application. So like Sarah said, there's like, you know, a couple hundred pages, some are shorter than others. I will say that I think RSF 1 had the most information simply because there were 73 programs, 73 different individual programs that were submitted. So, and we'll, like Sarah said, we'll share this with you as well.
And to say that, yes, we had 73 organizations responding in RSF 1. I think that's indicative of our economic community. Our health and medical community just isn't as big as 73 million. That doesn't mean that their needs aren't substantial. It just means that the number of individual organizations impacted is smaller. And Nancy, I appreciate your comments about taking time to go back through this. And I know that this particular RSF needs a little bit more attention. What it would be helpful for me at this point is to, you know, we already made, I mean, we reduced the city of Lawrence's direct aid reimbursement by 2/3 to get it to this point. We removed $600,000 in payroll expenses. And I removed payroll expenses from other cities as well. So I felt like before I cut further to try to change things, I needed more direction from the commission as to the priorities they have for it. If some of the programs, particularly in the direct aid programs from the cities, aren't as important as some of these other needs, that kind of direction is helpful to me at this point. If there are concerns that, you know, while RSF2 is really important and some of the programs in RSF3 are really important, if they need to be reduced in order to, because maybe the margin, as Commissioner Kelly would say, maybe the margin of error in terms of what the need is and what the ask is too great, that kind of direction is really helpful at this point. Like I said, during the City of Eudora's direct aid plan proposal, they have a very substantial small business program included in their direct aid proposal. It is not proportional to what was done inside the city of, for the City of Lawrence in RSF1. However, I do think most of the things inside RSF1 are largely going to benefit the City of Lawrence, not the City of Baltimore. So I do think any kind of feedback, thoughts that the commission has on how to go through this next stage of carving, I know this team would appreciate.
Well, Sarah, I'm sure we're going to give you that, but we've been at this for 2.5 hours. So I wanted to check in with the commission if you'd like to take a little break here and then come have a discussion, sort of, or would you like to plow forward?
I'd appreciate a break.
Daviana, if you could not share your screen and then we can, that'd be great. Do we want, how long of a break do we want?
What do we think? 5-10 minutes? Is that plenty of time there? Yeah.
Thank you.
Let's.
That works.
It's 8:08 now. How about we come back together at 8:15? So we'll
Okay.
just adjourn until 8:15. Sound good?
Thank you.
We are. Okay, it's 8:15. I think everybody's back. Sarah, is there any more presentation you have for us, or is it time to discuss?
It is time to,
Okay. Commissioners, anyone want to start this off, or?
Well, I'll confess that I only started looking at this earlier today, so I haven't really poured over it very much. I don't want to just throw out suggestions, or I guess Sarah, it was really helpful to me to hear you talk about RSF1. And now I understand why you presented the others first, and then this one last. I feel strongly though that it doesn't just need work. I think it needs emphasis with dollars. So I really, when we just might need to talk offline, but I do feel like we need to take a long look at it. But I want to study it a little bit more first, all of them. I just don't have all of this quite, I don't quite have my head wrapped around it yet, but I'll work on that, and interested to hear what the other commissioners think.
I'm in the same boat, Nancy. It's a lot of information, and my goal tonight was to get this preliminary draft from Sarah and everybody, and then spend the next few days looking at all of it in depth, and then coming back on Monday for me to reach out to Sarah and start asking some questions, because I mean there just wasn't a way to absorb all of this information in the last 24 hours, at least not for me. So I appreciate all the explanations that we've received and all the detail and background and all the effort that you guys have put into it. I'm just not prepared yet to ask anything in detail and start saying, well, can we move this here or change this here? Because I want the opportunity to look at everything.
so as I try to think about the calendar and the timeline to make this happen, if our next opportunity to discuss this is the 12th, which if I'm a little uncomfortable taking direction from individual commissioners privately and trying to necessarily come up with recommendations and then just presenting you with something on the 12th that we think is close to being adopted on the 12th. I want to remind the commissioners on the 12th is also our budget hearing for the annual operating budget. So that meeting will have other items on the agenda. We could start at, and we had talked about, we talked about trying to do that in person, and I'll get to that at the end. Do we want to try to at least have a backup date for a conversation after the 12th in order to, but I mean, this is the hard part, is like, we got a week here. I can do some of this work, but if you come back on the 12th and tell me, like, I want you to take 2 million out of health and medical and put 2 million into economic impact, I have 2 days to make that happen.
Yeah, I guess that's where my frustration was early on, Sarah, was we have days of budget hearings to go over a budget and this is different. And so I'm wondering if we might talk a little, honoring that schedule that the situation that we're in, if we might use these RSFs again. You know, they've done great work and we really appreciate their work, but quite honestly, we didn't give them much budgetary guidance. We essentially sent them off and said, tell us what you need. And they brought back what they thought were good proposals. We didn't give them any boundaries. I mean, the big boundary was 25 million. We didn't really give them any boundaries beyond that. And so to me, that's why my question to Jill was like, why is this one group so restrained in its, and another group brings us 9 million? I mean, we have these giant differences. I mean, even when you look at the differences in the municipalities, it's all over the place. And part of that is because I think they were moving so quickly. And we're giving them the benefit of the doubt, saying they put budgets together so quickly and they did a great job. I mean, they did the best job with the time they had. And I sort of feel like, I feel like maybe we could give them some better parameters. You know, I mean, even if we said, so I'm just thinking out loud here. Even if we said, we think health and I can never get this right. I want to say health and human services, but that's not it. Health and medical is the most important. Right now we're giving it 50, the recommendation is to give it 50% of the budget.
Well,
yeah.
Well, not if you include reimbursements and municipalities.
I did not include reimbursements, and I did include municipalities though.
Well,
okay. Yeah, so I mean, yeah, we can argue about the actual number, but we gave them a significant more than any other sector, than any other RSF, right? I mean, the recommendation is for sorry, I'm on the wrong tab. The recommendation for health and medical is 11,481,753, right? Of the 22,985,510, that's 49.95%. So I'm not saying that's the wrong number. I'm just wondering, I'm curious, do we really, I mean, is it really, what we want to do is go line by line and then come to one meeting and discuss which lines get in and which lines get out? Is that the best way forward?
I'm not saying it is. I'm saying as staff, I feel we have an obligation to do that. So we're doing that work and we will continue to do so. If it's your intent to sort of, I mean, and I apologize, you know, I think we talked about leaving this open-ended up front. If the commission had desired to have, you know, budget targets, we could have done that. And I understand none of us knew where we would be, and now we're here where we are today. But, you know, if it's your commission, if you want to have a target of saying some sort of like, you know, percentages, we could go back and do that, but it will mean cuts to some of those departments, to some of those RSFs. And
I guess, Sarah, just speaking for me, I would feel more comfortable if those RSFs, if those applicants would get together and say, you know I asked for 300,000. I think I can do a lot with 250,000. If that gets you, I mean, I mean, this horse trading that we're going to do next week just sounds painful to me. And maybe I'm.
And let me say, I think they're all in a different spot. So yeah. My concern here is that RSF 1 never met totally as a group. They did webinars and took applications, and then the ranking was done by 4 people. I don't know how I get 73 people together that all submitted applications between now and next Friday and get them to decide. And the same on RSF 4 on education. You know, that group decided they couldn't prioritize each other's requests. So I think I could do that with 2 and 3 if you wanted us to go back, but I don't know how we do that with 1 and 4. I'm trying to keep an open mind to that, but I don't know how we do that with 1 and 4.
I would just jump in here and say, I don't, Patrick, I don't know how people get in the tight timeline that we have, they could get pulled together and rework. I mean, I imagine the RSF leaders feel like they've done their job and they've handed it off, and now it's up to us to do the last hard push. And which, and again, not a perfect process by any means, but I think it's, imagine we're a lot farther along than most counties in terms of having really offered this up to the community and worked with the community for programs that, you know, by and large make a lot of sense. There's just not enough money to go around. But I don't know. All I know is I think we do need to have another fallback time so that we feel like we can have a real discussion, do some of that deeper conversation and work through this. And Patrick, that's not to say, you know, that we can't go back and talk, you know, have people think harder about what they're asking for. I just don't know that we can ask the RSF1 groups to
Well, I suppose
to gather up and go through a whole process.
Sure, I suppose we
Timely.
could assume that they don't want to do it, but I know one I having some knowledge of the school district who has completely changed what, you know, in a week, what they were doing, you know, as they put in their applications, and to see, you know, I appreciate the work of Robert and Jillian and working on that, but I think there was some surprise in the recommendation that if they didn't classify it and the way it got classified, I think there's some concern. I mean, Sarah, you explained that, you know, a lot of these districts are going to distance learning, and to see none of those supports in the recommendation, I think is really hard for them. So I mean, we can make that decision for them and just cut a bunch of other stuff, but boy, I just don't see how we don't ask for their input on it. Especially that group who didn't rank anything, and it's not in our high, medium, and lows are not even included. Even from the districts, we don't have their high, medium, and lows. I mean, we don't know what I know you're sending that to us. So, I mean, just.
We have it, and I'm certainly willing to try to call that group back together, but I mean, I'd invite Robert and others that were on that call. I mean, I also think that's a group of people a little bit that aren't used to collaborating together in such a space, that they're used to placing their needs under someone else's. Because generally educational institutions work as independent entities. So I'll take it back to them. And I'll tell them, like, if not, you know, here's what we came up with. You help us come up with something better, and maybe they will feel like they can make that happen at this point. I just wanted you to know the challenge ahead of us, because we specifically asked them to do that and they felt they couldn't.
I would say I was in that meeting. They spent almost an hour talking about how they didn't feel it was appropriate to prioritize other school districts' needs, and to come collaborative as a group and come forward and say, this is our proposal. So maybe they need 3 hours. I don't know. Maybe they can do it in 3, but they couldn't do it in 1.
I mean, they didn't even provide us priorities, did they? I mean, the other RSFs provided, you know, how they made those decisions. We didn't get that from them.
And that would have been really helpful for staff as we were trying to evaluate those. You know, if it was, and like I said, I do think education is changing, you know, and it's evolving, and having flexibility so that a district can use this the best way possible. I think we can do. The problem just comes into, you know, right now that some of those districts have very little money, or some of those schools and have very little money, and some have more. We included private schools in our calculation. I will be honest, in my calls with other county administrators across the state, they're not funding private schools. at all. I felt it was important to keep that process open and to allow them to apply because they are eligible by the state. If you want me to make sure that by per pupil, each one of them get a certain amount, we could try to do that and give them the flexibility to use it that way. But if we're staying, I just think we would need to have some guidance to go back and give to them in terms of what your priorities are.
Is O'Connell Youth Ranch considered a educational facility? I mean,
since they were asking for enhanced connectivity and distance learning, there's a lot of groups in there that aren't necessarily educational institutions. Child Care Aware is not an educational institution. They're an advocacy organization on behalf of them. So we tried to fit people functionally. And honestly, and we had a lot of back and forth between, is this RSF1 or RSF2 or RSF3? That whole process is a complete manufacturing on our part as a way to try to do this work. And commissioners, my only other option was to put an application on the internet and take all comers. So we recommended using the RSF format because we felt like it was reflective of what the state told us the needs were in terms of the funding and the priorities and how we were already working in the community. And I've told them since then, don't worry about it. Now the county has it. The RSF really doesn't matter anymore. We'll make sure it gets funded and gets put in the right spot. So, certainly we could move O'Connell to Housing and Human Services. It's just, I can't go back and have them necessarily re-rank that in that prioritization order unless that's what the commission wants to direct to do.
Robert, can you talk to me a little bit about how you made, so like, I noticed when I was going through RSF4, some of the requests on there, like one type of online learning would be approved, but then the next one would not. How did you make that decision if you didn't have any guidance from the RSF? I don't see how online learning was, or distance learning was aligned to you listed factors on health. Just tell me your thoughts on it. I'm sorry.
Equity would be what I would say, Commissioner, that, those smaller requests for technology for people that, specifically for people or students that can't distance learn or don't have what they need to distance learn, that's why they were in there. We said safety, equity, childcare, prevention of the spread of the disease. So that's how I'd answer your question, and it's pretty minimal, the ask in a couple of districts.
Yeah, I just still don't, I look at some districts and as I look down the chart, and I will admit, I haven't read every single program, but one technology social distancing will not be approved and another one will be. And I just, it must be that you've read all the program charts and can tell, yeah, this one was equitable and this one was not. Is that what you're telling me?
Yes, sir.
Okay.
So and commissioners, I don't mean to sound defensive. I'm incredibly frustrated by the timeframes put upon us by this process. We as a team talked about, we should have asked for all of this material to come in a week earlier. And then we could have had more time to have more discussions with the commission about prioritization and ranking and more time to get through it and share it with you in advance. But that would have made the time frame in which organizations would have had to submit a request down from less than 30 days to like less than 2 weeks. And I felt like I just couldn't do that to them and try to have any sort of an open public process into submitting it. So that being said, we are in a difficult position here. Where you all are forced with a lot of very difficult decisions as to how to approach this. I do think we're going to need more time. So maybe the best answer is just to look at calendars and figure out when we can hold a special meeting for further consideration.
I think that would help a lot to take, I think we absolutely need more time. I want to, well, Jill, is there someone, I think I got a signal that someone's raising their hand and wants to speak. Is there anyone that's out there that's?
So if we're done with commissioner comments, we could take public comment. But
Okay, I just wanted to make sure that that person isn't neglected. I think we absolutely need to set aside a big block of extra time just to take some of the pressure off. Patrick, you definitely have a deeper understanding of the school system than I will, and you're obviously really frustrated. I don't begin to know how to get at some of the concerns you're voicing in the short time that we have, but I'm open to suggestions. And I want to, for my part, I want to make sure, I think everyone, I mean, this has just been a really tough assignment, and we'll get there, you know, we'll get there. We've got a great base to work from. But yeah, I'm ready to look at a calendar and then do a little study. And then, but Sarah, are you willing to talk with each one of us just to hear stuff? It doesn't all have to be.
No, and I'm certainly available to answer questions. We will continue to do our work to sort of scrub it. I guess if there are commission priorities in terms of, like, I want a budget, you know, I want there to be percentages, you know, I want RSF each, you know, we want to set percentages of the funds that each RSF is going to get. I feel like that's a collaborative decision-making process. So that to me belongs in a public meeting. But certainly I can help walk you through it. We can answer questions. We can continue to do that work. You know, I guess, I mean, let me tell you, I try to be pretty good at reading the tea leaves of what you as a body want. I'm not always right, but I do my best. What I'm hearing is that the commission would like to see more from RSF 1. What I'm hearing, but I'm not necessarily seeing that you're unhappy with the prioritization that they came up with. That sort of highly impact businesses, PPE, those things, I'm not hearing you have concerns with that. It's just the question that we weren't able to go deep enough to make an impact. And then what I'm hearing about RSF 4 is, boy, oh boy, we didn't get a lot of help, necessarily a lot of collective guidance from the districts on how to do this. I think you would, and I think you want flexibility for people to be able to meet that need. I think we can try to go back to some of the partners in RSF 4. I guess what I would ask you is, are your concerns largely with school districts and K through 12? Do you feel relatively comfortable where we are in higher ed, or is the whole thing something we need to look at?
I guess I would just say, I think they were probably, what I anticipate is when they put their applications together and when they put an interpretation of why they didn't give you priorities is their priorities are constantly changing right now. They are all over the place. They were all face-to-face, then they were hybrid. They didn't have guidance from the state. You know, they're just all over the place. And I think I understand why they're having a hard time coming up with priorities, because each district is doing it differently. And so when you say, you know, they all have to respond to their own boards of education, and they don't know, I mean, they're trying to make those decisions the best they can right now. And I think it's a little hard to anticipate. I just think it's such a changing situation right now that it makes it very hard to anticipate and prioritize. So I would guess that they would appreciate hearing, you know, another opportunity. But I could be wrong. That's just what I would anticipate. I think as far as RSF 1 goes, I was really impressed with what came from the Douglas County Foundation. and I don't understand community foundation, and I would love to understand, is that a better way to do it than look at 73 or 72 different applications? You know, because I think about these businesses, and I know some of these business owners, they're trying to run a restaurant, and the idea that they're going to fill out the equity impact survey, that's a lot. That's a lot to ask these individual businesses to do. I mean, not fill it out, but do the application. I just think it may have been overwhelming for those individual businesses. That's just a guess.
And I do think, so to be clear on the DCCF application, it's funding workers and employees of those organizations. It's
Right.
not to support business owners. And it's going to work through 501c3 to provide those supports. So if the intent is to have more umbrella organizations that are running programs for business owners and small business owners, you know, we can try to see if we can find some partners in our community to help us manage those processes for us. I'm not sure that's something the county can, you know, as an organization, manage effectively. But if what I'm hearing from you, Commissioner Kelly, is that sort of, you know, group grant process is helpful, and we certainly felt it was, I think we're really hampered by the time constraints to put all this together.
Yeah, and I want to be clear, I'm not frustrated with anybody individually. I'm frustrated by the timeline. I'm frustrated by the process, I suppose. And I know we tried to put the best process together, but you get down at the end and you kind of go, I feel like I want to make sure we're getting good information to make good decisions, and I'm just not feeling like I'm having good information to make good decisions. And that's where my frustration comes from.
So if I can take us quickly back to RSF4 and what I'm hearing from you, you would like to give the groups represented in RSF4 another opportunity to sort of modify or change their requests. So right now they have approximately 13% of the funding, of the total funding pool, 15%. I'm not necessarily hearing that you have concerns with that funding in that amount. And I would say there are funds for education in round 2. And hopefully CARES Act 4. But I'm not hearing a whole lot of concern necessarily with the amount that we've allocated towards that RSF at this time in general.
I don't have a problem with that amount. I guess to the point that, you know, Patrick's been discussing and it's been mentioned, is that with the schools, everything has been changing. I mean, day to day it's changing. So maybe just to go back to them, even if it's just a phone call or an email, and say, what has changed since you've submitted this? Do you want to change it, revise it? And just follow up with them, because we know that it's changed a number of times and it is a moving target.
We can certainly go back to them and try to ask them how, you know, if they would like more flexibility in how they put their requests together. But I'm going to tell you they're going to come back with differing amounts. So any guidance in terms of like, we should just do that as a starting point and see where we end up. And then commissioners can maybe have a little more information to make those decisions. I certainly feel like there are a few projects, I think, in RSF3 that could be reduced, like we talked about, to try to make it a little tighter, in terms of like the hotel program with LCS is pretty large. It's larger than what they've used to date. We could try to lower that amount so that we make sure we're using our funds effectively. And I think there is some room on some projects in RSF2. You know, I guess I just want to, you know, and certainly with the direct aid requests, you know, I guess, particularly with our peers in the cities, and there was a lot of conversation statewide that cities have needs met and be represented in this process. I'd like to go back and have another conversation with Barack about the small business program in Eudora. But I'm really proud of our city partners for stepping up and talking about utility assistance. And that's a huge need in those areas. So I do think I can trim some things back there, but just know that, you know, I generally have been, you know, I don't want to go too far in terms of managing what they've asked for and what's appropriate.
So I think we talked about looking at calendars.
So there's a couple ways to do this. And you know, and Patrick, I know your calendar is really rough. We could certainly find time like on the 14th to meet again after the 12th to give ourselves some time after the 12th. We could extend our conversation on the 12th. I'm also open to finding times before then, between now and the 12th. But I know that might be harder. We have a CJCC meeting coming up. I have some pretty substantial conflicts in the first part of next week.
We also need to make sure we take public comment. I've gotten wrapped up in the conversation and not doing my job as chair. So while everybody's bringing up their calendars, do you want to take, let's take public comment first, and then we'll dive into calendars. Sarah, is there anybody there at the courthouse that would like to provide public comment?
There is not.
And I do think we have somebody online. Is that right?
Yes, I've moved him over to the panelist side.
Thank you. Hi, Michael. Would you like to provide some public comment on this item?
Yes, thank you very much. This is Michael Davidson, the Executive Director of Explore Lawrence. I have a few comments, and one of the things I want to start with, it seemed in the evaluation of the grant we put together for the hotels, and the county did encourage us to put together a group grant. So we did that, and we encouraged the hotels not to apply separately. But Sarah made a comment saying, because the hotels weren't supportive of the efforts to put homeless people and, you know, to fill up with the need at that point, that seems to be held against the group. Those individual businesses make individual business decisions. That was a very crazy time for us in Lawrence. They were dealing with their owners, with their franchise. They didn't really know how to handle it. It took a while to find some hotels that were going to work with the shelter in the county. I don't think that should be held against the application. That's point one. Point two, 5% for economic development, less than 5% actually. I think that number really needs to be a higher number. So that's how much looks like allocated to economic development is 1.2 million, is about 5%. In terms also of saying that working with the Lawrence hotels doesn't benefit the county, I don't think that recognizes where the people the hotels employ live. Sure, the hotels in Lawrence, they can live anywhere, you know, within Douglas County and the surrounding areas. And the other question I have is, why is Peasley under economic development as opposed to being under education? Because that's a big chunk of the money that's been allocated. And again, I do recognize how difficult this process is. I appreciate all the work that was done. We worked very hard with the, you know, the RSF1 group. You know, I appreciated the input that Brooke gave us as we went through the application process. But, you know, we not only, you know, are doing the one for the hotels, we also are the sponsoring agency for all the restaurant applications. So again, they seem to score high, they just didn't get funded. So those are my comments, and I thank you for the opportunity to speak.
Thank you, Michael. Any other public comment? Okay. Seeing none, we'll bring. I think we were looking at calendars, bringing it back to the commission.
So, commissioners, Monday morning, August 10th.
No.
Patrick, do we need to just start with?
Yeah, I'm sorry. That's a Board of Education meeting that night. So I have some time Tuesday morning. I have a chunk of time. I also have a chunk of time Thursday morning. I have a chunk of time Friday evening and Friday morning. So there gives you a couple of options.
Tuesday
I'm
morning.
available Thursday and Friday morning.
Okay.
Same,
I do want to
same
remind.
here for me.
Okay. I do want to remind the commissioners that we do have the judge's lunch on Friday at noon. So, and we can certainly, so I can make both Thursday and Friday morning. The 13th and 14th is what we're talking about, correct, Patrick?
Yes.
Work. We could certainly start at 4 o'clock on Wednesday, the 12th too as well, and spend an hour on it there, then go into our county commission meeting and continue conversations after the budget hearing if you want. But I would say I did have, there was some desire expressed about doing that in person, but still trying to have a hybrid conversation in terms of, really recommending to folks that want to listen in to use Zoom function for that. I've had a request from IT that they think they can make that happen, but they'd like to have commissioners here an hour to hour and a half in advance to test that out before we started a meeting. So initially my request was going to be if you could come at 4, we could test that out and our meeting would be at 5:30. If you want to do it in person, if you'd rather just stay with this format, we can meet at 4.
I'm able to come early on Wednesday, about an hour early if that's what's needed.
Meaning 3 or 4?
Meeting 3.
Okay. Michelle, would that work for you?
Yes.
Yeah, that's fine.
So I guess what I would say then, if you came at 3, we could test and try to, and be ready for a 4 o'clock, for an hour at 4 o'clock to work on it. Come back for our regular business meeting at 5:30, do the budget hearing. And I think there's maybe a small item or 2 on that agenda. And then we can still talk about it more at 5:30. And then do you want to go ahead and schedule both Thursday and Friday mornings, or would Thursday not having it off so that we could try to do some of the work that you might ask us to do be helpful, and then come back Friday morning to hopefully wrap up?
I think giving you Thursday to do some work sounds smart. Yeah.
That works for me.
Okay, so what time would you like to start on Friday, and do you want to do it in person?
I can start as early as we need to start.
Same here.
Okay, so let's start at 8 o'clock, and we'll probably have to adjourn before the judges. Yeah, and right now our plan is to lunch in person, socially distanced, at the Flory building at the fairgrounds where we can spread out and be far apart. And then we can plan to have that done in person as well, Commission, on the 14th, since we will have tried it on the 12th. All right.
Okay.
And then, so then then we would finalize on Friday, and then on the 17th, it goes to the state, right?
Well, like, so I want to be just really clear. I had really told Brooke, who by the way, worked all weekend trying to get this done and ready for the commission to see, that we would be done on the 14th so that she could begin entering these voluminous tabs to the state on time. So we absolutely have to be done. And I've just cut her time out from underneath her to get this done. But we do have we have over the weekend and Monday to get it in.
Okay. Thank you, Brooke.
Thank you, Brooke.
I will bake something nice for you. Okay, any more on this item, Sarah? Anything? I'm not going to say anything more you need, because I know you need a whole lot more than we're able to give you tonight, and I'm sorry for that.
No, I just want, oh, go ahead.
I do want to appreciate all the RSF folks and Brooke and your whole team for the tons of work. Please don't interpret my frustration. It's not anything anybody's done wrong. It's the process. We were just working our way through it. So we'll get there. Thank you for your work.
I just want to restate so that everybody knows what we're doing. We're all on the same page. So on the 13th, on Wednesday, commissioners will be here early at 3 to test. We'll have a 4 o'clock work session where we will talk about this for an hour. And then we will also place it on the agenda for 5:30 for a little bit more time, hopefully not keeping you till 9 o'clock for continued conversation on it. And then we plan to bring the commission back on Friday morning at 8 o'clock to work through it that morning. So approximately, I'm going to say 8 to 11:30 if we need that kind of time.
Hey, Sarah, I just, because I know people are listening, but you said the 13th, but I know you meant the 12th. Just.
Did I? You're right. Thank you, sir. I appreciate that. The 12th and 14th. And again, I will make sure I reach out to individual commissioners and we have some groundwork to cover in that time frame. So my hope is that when we talk on the 12th, we've made a lot of progress. That's going to be our goal. That's all I have, Commissioner Kelly. And thank you for everyone's help and support with this.
All right, moving on to appointments. I know we got one notice today from Robin. Has everybody had a chance to take a look at that, or do we want to push that? We'll push that back to next week. I don't think we have any other appointments today. General public comment. General public comment is held at the end of each meeting with a limit of 1 comment per person. The commission reserves the right to place a time limit of 3 minutes per speaker if desired. Individuals may not give unused time to other speakers. As a general practice, the commission will not discuss, debate, nor will the commission make decisions on items presented during this time. Rather, they will refer items to staff for follow-up if necessary. All comments should be directed at the county commission. Sarah, is there anyone there who would like to provide public comment?
No, there is not.
Is there anyone online who would like to provide public comment? Just need to raise your hand and we'll move you in. Okay.
I don't see anyone.
Thanks, Jill. Okay. We'll move on to Commissioner Administrator Miscellaneous, and we usually turn it over to Sarah here.
Thank you, commissioners. Just 2 quick things. One, in last week's weekly memo, we shared some dates that the city of Lawrence was hoping to have conversations with elected officials involving their economic development strategic plan. I'll email you that separately to sort of rise it back to the top of your list. And so that commissioners can check their calendars and get that on their schedule. So we'll do that tomorrow. And I also want to state that I've spoken to the county clerk's office, and we are holding Monday, August 17th at 9 a.m. for the election canvass. We don't know at this point in time if it'll be in person or Zoom, but I would ask commissioners to hold their calendars for that and let us know if you have any conflicts. And that's all I have.
Hey, Sarah, quick calendar question for you. Did we manage to get the Hams Quarry item pushed?
Yeah.
a different week?
We did, but I'm going to mention it specifically at next week's meeting and this really came both in conversation of our difficult schedule at this point in time, and the city of Eudora has requested a little more time to have their meeting tonight, and they would have had to give us their materials tomorrow morning in order to make our agenda timeframe. So really moving the quarry conversation to the 19th is a better fit for them as well, but we will put it on our agenda for the 12th so that anybody who pops up to look at it knows that it's gotten deferred. And I have verified that County Council is available on the 19th.
Any other items, Sarah or commissioners? Okay. Seeing none. We'll see everybody again on Wednesday, and we are adjourned.